Good evening. I'd like to call the City of Menasha Common Council Budget Review Session to order. Please rise and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Could we have the roll, please?
My stuff out. Alderman Taylor. Here. Alderman Sevenick.
Here.
Alderman Langdon.
Here.
Alderman Kruger.
Here.
Alderman Tom Grady.
Here.
Alderman Ted Grady.
Here.
Alderman Rapella.
Here.
Alderman Nichols.
This evening is people from the gallery to be heard on matters pertaining to the agenda, and I don't see anyone there this evening. So we'll move on to item E, which is the budget for Neenah Menasha Fire Rescue. Chief Clone and his management team are here this evening, so I'll let you take it away, Chief.
Thank you, Mayor. I have a handout I'll hand out to members of the council.
You have one, or you're just following along on the screen? We don't.
All right, thank you for allowing me to present our 2019 budget. With me tonight, I have Deputy Chief Victor Voss, Assistant Chief Green, who is our fire marshal, and Assistant Chief Pegla, who is our training officer. So glad they're here tonight, and help if we need to ask them some more in-depth questions. So we have our mission statement. We created that a year ago when we did our 5-year strategic plan. So just reads, Neenah Menasha Fire Rescue consists of committed professionals whose mission is to provide the highest standard of service through prevention, education, fire suppression, emergency medical response, tech rescue, and community interaction to preserve the quality of life and property for all those within the cities of Neenah and Menasha. All right. Too far? There we go. Thanks. I was hitting the arrow. Okay, that sounds good. All right, here we go. You can push it forward, Brent. All right. Department. Department overview. Career Fire Department, we provide service 24 hours a day, 7 days a week, and 365 days a year. We have 63 line staff members and 5 administrative personnel. We have 3 shifts of 21 firefighters working a rotating schedule. We have 4 fire stations, 2 in Neenah, 2 in Menasha, 4 engines, 1 ladder, which is a quint, 1 command vehicle, and makes up 4 administrators, the chiefs, and Tara, who is our office manager. We respond to pretty much everything. 25 years ago, it was just to fires and fire alarms. But since then, we have really added on to those different areas that you get called for everything. Water in the basement, my pipe burst, you name it, we get called for it. So we do provide structure, vehicle, wildland fires, auto accidents that include extrication, patient treatment, stabilization, and fuel cleanup, medical responses, trauma responses, carbon monoxide, and mass casualty incidents, open water, swift water, ice rescue, dive team operations, confined space, high angle, trench, and subsurface rescues, structural collapses and rescues, hazmat response, gas leaks and down power lines, smoke odor complaints, animal rescues, and recreational fire complaints. Our call volume, you can see we have history since 2004, and last year we were right around 2,700 calls altogether with EMS, fire, and different calls we go on that we listed in the previous slide. So about 2,600, and we're about, I think right now we're about 100 or 150 above that right now from last year. So, and this is one of the ones that we're proud of. I hope you're proud of it as well. This is not something that we can fudge numbers on. Deputy Chief Voss grabs these numbers right from the comm center, the dispatch center. So those are numbers that are plugged in from the system through our MDCs when we're en route on scene. And so as you can see, we compared Village of Fox Crossing, Town of Neenah, City of Oshkosh, City of Appleton, and Town of Harrison. And you can see our response times on average are about 5 minutes and 32 seconds. And that's from the time of the alarm to the time they arrive on scene. So that's turnout time, that's getting to the truck, getting their gear on, and getting on scene. So the nearest one is Appleton and Oshkosh. They're both right at 6 minutes. So we're 30 seconds, not that it's a race because it's still about safety, but it is about getting to the scene when our citizens are having their worst day. So we take pride in being able to respond quickly. That's why we're here, and so we're pretty proud of that. We actually improved from our times from last year. We continue to stress to our crews that we need to get out in a timely manner, and they're doing a great job. So some of the training that we've done in the past year, we did industrial training, confined space, some terrorism and weapons of mass destruction, fire attack procedures, rapid intervention, vehicle extrication, aerial operations, mass casualty, advanced search and rescue, and then our EMS. We've added a couple skills with our Narcan and combi tubes, which is tubes we put down in case somebody's having, if they're pulseless and not breathing, to help them get air quicker, and so it's not something that's hindering them from breathing. So we also do our water rescue, our dive, shore base, and open water. So in 2017, we trained over 7,000 hours, which is about 113 hours per staff member. Fire prevention and education, very proud of this as well. Our inspections and public education, we've been recognized through the state with our different things that we do, and we cover all age groups from the preschoolers in our schools all the way up to our elderly that live in some of the homes around in our districts. We even teach the high school kids what to do when they move on to college and they're living in dorms. We do some dorm safety. So we provided over 3,000 inspections, which had 2,900 violations found and repaired. And we had 850 public education events last year, which were about 1,500 hours. And 2% dues for this past year, Menasha's share of our 2% dues was 45,000, and Neenah's share was 85,000. Those are dues we receive from the state, and those go to our towards our public education, safety, turnout gear, things like that. So that's what that 2% dues from the state is for. And there you can see some of our events that we have, our fire prevention and education. We do smoke alarm installs, rock the block, parades, station tours. We provide fire extinguisher training to different businesses within the community, juvenile fire prevention, public education, grades 1 through 3, fifth graders, the preschool, senior high dorm, senior citizens, and we take part in Community Fest. I'm sure there's probably a couple other ones that we missed, but those are some of the big ones that we do. Our fire department class, which is our insurance service office rating, we're currently at a 2. And we've had some conversation about becoming a 1. And we do have the person that comes to go through and grade our department. They're coming in December to work through. So we've been working on our worksheets on providing what equipment we have. We've been working with the water department to make sure the flows and the hydrants are tested and they're at the proper flows that are needed. We work with the dispatch center, making sure that if there's multiple 911 calls that come in, that there's a backup person there to take that additional call. It also takes into consideration our training center and then our mutual aid partners as well. So there's quite a few areas that ISO will come and do testing on. And so we're preparing now for them to come, like I said, in December. So our goal is, of course, to become a 1. And one of the other goals you'll see later on is that we're gonna, if we become a 1, our goal is to work with some of our industry. The industry also has a rating, and depending on what that is, we're gonna start working with our larger industry and to see what we can do to help them get their rating increased as well, which of course helps them save money in the end too. So that's one of our goals for next year. Some of our accomplishments from this past year, this is of course the 10 months, we hired a new assistant fire chief of training, Jim, which is sitting here tonight. We hired 3 new firefighters. Chief Green and I completed a lean certification at Fox Valley Tech. We put some new SCBA into service that we received from our grant. We did a couple of EOC, Emergency Operations Center, tabletop exercises with both cities. We created and implemented a new driver training manual similar to our firefighter manual, and our goal is to have that manual for each level of job function on the department. So we just finished up the driver training one, so we're going to work on a fire inspector one, and then a fire officer, and then our shift commander. So each level will have a book that they're able to take and to do some training with, get checked off, make sure that they're feeling comfortable with whether they move up or if they're in that position, because again, we're going to have this, not next year, but after that, we're going to have this, starting to see this changeover where there could be 3, 4, 5 retirements a year now for the next few years. We have 1 next year, but the next few years after that, we're going to see multiple firefighters retiring. So we want to be able to prepare them for their next job task as we move down the road. Let's see what else we have. We ordered new engine 36. We did a lean project for cancer awareness. So depending on how we respond to structure fires and how long we're on scene, we have put into place procedures in which the firefighters need to be safer as far as how they wash their gear, how they carry them back on the truck, making sure equipment is cleaned properly, making sure they're not taking things home to wash in their own washer dryers at home. So we have that, we put that together, and we're still working out a few things, but for the most part it's in place, it's working well. We updated our 5-year strategic plan. We recertified our first responders, EMTs, and paramedics. And like I mentioned, we're going to be doing our ISO testing coming up here in the first part of December. Some of our goals for next year is to meet our growing needs for training all personnel, like I just talked about, for some of our new firefighters that are starting to move up into higher positions. We would like to have at least 6 training events with our multi-agencies. And that is also points given to us for ISO as having 1 or 2 training sessions with our mutual aid partners. So that's one of our goals. Improve records management. We've done a really good job this year improving our training, the recording of what training we do. We made some adjustments to that, made our training line items easier for the officers to put in and add to. So we're better describing or having a description of what kind of training and for how long for each engine, each station. So what else are we doing? We're going to continue our strategic plan, continue to improve our Facebook presence. I think we gained like 5,000 people that have followed us just over the last year. We seem to really, try to post some live training, some trainings that we're doing or events, and we had just the Tim Patterson carving the pumpkin. There's like 17,000 people that saw his pumpkin that he carved. So we would also like to create an aldermanic district reporting for our aldermen, and something new that we've talked about. We would like to not just send a report to you monthly or periodically, but we'd like, if there's something happening in your district, we'd like to maybe as much information as we can just to let you know what's happening, or maybe it's even a public education event, just to let you know what we're doing in your district. Improve our business and industry ISO ratings. I mentioned that a little bit, and we are looking to switch out our mobile data computers to iPads on our apparatus. I don't know the exact numbers. DC Voss probably has a better idea, but our MDCs that we carry on our trucks are probably around $7,000 or $8,000 a piece, plus then the maintenance. We're looking to, because of the new system that our counties are using, we are able to use iPads. So you know iPads are roughly $800 or $900 compared to $7,000. So we have our first iPad that we're going to be testing on our engines, and hopefully be able to make that switch. So having a huge cost and having to upgrade down the road our MDCs.
Can you go back, Chief? I had one
Sure.
question. The second question there, you have 6 training events with multiple agencies.
Yes.
And page 55 here, on their operations, you state that we assist another community and participate in an automatic aid agreement with the city of Appleton.
Mm-hmm.
Who is the other multiple agencies?
It could be the police departments, it could be Gold Cross Ambulance, it could be City of Oshkosh, it could be Fox Crossing, it could be whatever. In the past few years, we've done some training with our police departments and Gold Cross Ambulance for a mass casualty type incident. So all those different events where we're able to use our radios and work with different communities and communication, that's all part of our grading for ISO, making sure that especially Appleton, because it's auto aid, because we do get points for having auto aid, and there is a pretty strict requirement of how many training, but it can be any outside agency that we work with. It could be the sheriff's department, it could be anybody that is outside of our cities.
So the only automatic mutual aid agreement is City of Appleton?
Correct.
Thank you.
Correct. Some of the work that we do in the community the past year, we had our firefighter Scott Harding was awarded Firefighter of the Year by our American Legion. We started the For the Sake of Jake fishing program, which was Assistant Chief Peglow's son who passed away, and Alderman Kruger helped us get started with handing out fishing poles and different lures for kids. They come to the station for the summer to keep them busy and have some fun. So we started that, and that's seen a great response, and people donating fishing poles and fishing gear. It's pretty cool. So appreciate that. We did our annual bike draft tour for Burn Camp. I think they raised like $15,000 doing that. So the bike tour, we got a $2,500 grant from Walmart for public education for smoke detectors and various things that we use for public education. We were awarded a $9,000 grant by Capital Credit Union this past year to help replace our little flotation boat that we have at Station 35. And I have to give the mechanics credit there. The $9,000 was the boat, which we got at cost through Mercury Marine. They also donated a new motor for the boat. One of the problems we had was that the new boat was a V hull, and the other one was just flat. So our mechanics, with the money left over, built a trailer for that boat on their own. So instead of buying a $5,000 trailer, they bought they bought the parts needed for it and built it themselves. They welded everything, everything. So they did a great job. So we now have a new boat that we can move around, push around a lot easier, get closer to water, less strenuous on the staff having to lift it off the trailer. They can now glide it into the water and get closer than we could before. So we are still working with the Bruce Peterson family for our water rescue fundraiser for our dive team, and that usually takes place in February for the opening of sturgeon spearing. We have worked with Gold Cross to teach hands-only CPR at many community events, and we just did one today as well with some grade school students from Shattuck. So we've continued to reach out and spread that skill not only to adults but to our kids in school as well. We sponsor the Menasha Max, and we have a fire department night. MDA Fill the Boot. Over the past 5 years, they've raised $60,000, and that stays in our with the kids within our two communities. We do the Nina Mayer's Golf outing, and the firefighters donated the air fill station for the bikes on Loop the Lake Trail. So I'm sure I missed a couple other ones, but proud of what the firefighters do in the community, and they keep coming up with new things, and I appreciate that. So budget prep. So we have met, or this is our third budget preparation, and so our goal when I became chief was to be able to really dial in on our line items so that we know exactly what we need for next year. And I have to say that first year when I took over, we literally struggled with numbers for 3 months trying to figure out right up until budget time on where some of the monies were going and what it was for. So Deputy Chief Voss and I, Assistant Chief Green, we all came together and really tried to define what we really need. So we created a Excel spreadsheet. So when it comes to budget time, when we start doing our budget, we already know what we used exactly to the T of the previous year. So there's no guessing in what we need. Most of our budget is given to us from finance directors on the fuel and gas and electricity and things like that. But that Excel spreadsheet really helps us determine what we use, especially for the testing of our equipment. We know exactly what we have to spend for testing equipment, things like that. So it's made our process easier. It's made it, I think it's made it a more, I don't want to say an honest budget, but we know exactly to the T what we're going to spend in our line items, obviously except for utilities, but we've done a good job with, I think, with preparing our budget especially this year. The other thing that we've done in the past, and I think this helps down the road for future assistant chiefs, in the past, even I, Deputy Chief, we never saw the budget, so we didn't know what it looked like. We didn't know line items. It was all new to us when we took over. So one of the things that we did is that we kind of broke out our budget in the fact that there's training in the budget. So Assistant Chief Peglow takes care of his training budget. He has a certain amount of time to get back numbers to us and what he needs. Same thing with Assistant Chief Green. And then we go one step further and break it out into our different teams that we have. So our water rescue team, they let us know what training they need or equipment. Same thing with our physical fitness. There's different groups that we have, and that way we allow them to take or have an idea of what the budget looks like. And we think it also helps them kind of manage, I think they kind of take ownership in their budget, and they do a really good job of, hey, they're not going over. So it kind of works for us on two different ways. One, they're getting to see what the budget looks like and what we have to do through the process, but it also gives them a chance to take some ownership in it and be responsible for what we have. So some of our budget changes, we had moved some of our water rescue budget into our operating budget, and The reason we did that was moving the majority of our water rescue line items, which was about 5, I believe, to our operating budget. It didn't result in increasing line items because when Deputy Chief Voss and I took our positions, our water rescue budget was $20,000, $22,000. And over the past couple of years, we've really made some stride to make some changes in that. And that budget literally this year was $3,000. And that was all the water rescue. It isn't dive, it isn't open water. It's all of our water rescue was about $3,000, $3,200. So instead of having 2 of the same line items in our budget, we thought by merging them would save us 5 line items in the budget. We require when there's water rescue training, that they train on shift. There's no training off duty anymore. So that is the reason why we switched over and added that into our budget, into our operations budget. So I have a list, and I can sit down. The presentation is pretty much done. I just proposed some of the cuts that we had after the mayors and our staff had met to go over some cuts and the finance director. So those were some of the big ones to get down to where we're at today. So I will sit down, and if you have any other questions with our different line items to help explain, I'll be more than happy to do that. So I don't think there's any more, Vern. So yes, so we've been, since 2004, shouldn't say 2013, since 2004, we've 2.145 million in grants. So that's a couple rounds of SCBA's and some different equipment purchases. The fire station was one of them. So Shift Commander Schultz has done a really good job at applying for grants, and people that he knows, he's grabbed grants that have won and put our information into it. And so he's done a really good job at providing us grants for the fire department. So
Alderman Sevenek?
Oh, you put me on?
I think it's set up that it goes on automatically when you hit the
Yeah,
button.
no, but I turned it off and then, okay, but anyways, Chief, I have multiple questions, but I'll ask the 2 easy ones first, and that is, from your presentation, you had talked about different types of programs, one being 5th grade then and now. Can you explain what that is? And then the second part of that question, unrelated, is terrorism training. Can you explain what is involved with that? And then I have some follow-ups.
Sure. Vern, you want to just talk about the then and now?
Yeah, the Then and Now program, basically what it is we have 2 firefighters that go in, and one of them has equipment that was used, a few decades ago with the fire department, and it shows how the advancements of the fire service, our equipment, and everything else has been. So basically, it's kind of a look back in the fire service from yesterday to today, so then and now, and it kind of gives the the young kids kind of an understanding of how we progressed in our equipment and everything.
That's cool. Okay. And then the other one was
The terrorism training. That, for right now, it's a more of a basic training where we're working with our police departments to, it has been classroom type terrorism. I mean, we have the water, when you're looking at the water plants and things like that. So it's more classroom type, but as we continue and Assistant Chief Peglow's working with our police departments, we'll be working on all the different types of issues that we see with the shootings and things like that. So that terrorism is just one of the other areas that we've been slowly trying to become more familiar with to aid our staff in case something like that happens. Like I said, most of it would be with our water departments or water utilities.
Okay. As a member of the Menasha Fire Rescue Committee, we have been discussing the possibility over, several years now, fees for outside services, and obviously your budget doesn't reflect any kind of fees, because then there would have been added revenues. So are you or your staff looking at any of that?
We have looked at we have looked at what fees for,
And just for the public, so they know,
Yeah.
I'm not talking about going to your house. I'm talking to going outside our own community,
correct,
whether it's with the water rescue or even fire.
correct. Yes, we have talked about that. I have done some research on what we're able to charge for or not charge for. I don't know all the rules, and John and I have talked about what we can, and John can correct me if I'm wrong, but it had something to do with being able to charge, but may go against your tax levy or something like that. I don't remember what it was, but John and I have had some conversations, and really it's just, be to the point of being able to talk, just to the point of being able to, talk it over at our joint finance to see what fees we want to charge. I know our, Fire Prevention Bureau has, fees that for false alarms and things like that, but we haven't put anything in writing as far as, neighboring communities.
The shared revenue is the issue.
Oh, the shared revenue, yes.
Okay.
Thank you.
The other issue is there was, I guess, a little confusion at our last council meeting about the $700. And I just had a sidebar with Alderman Taylor. He's under the and I remember you saying that this applies to every firefighter, but if that's the case, then the dollar amount isn't what it should be in the budget, because what you said about what, 5,000 something? And if you take 700 times the,
No. Yep.
oh, the 70.
Because that was the increase, because it was at 621 or 630, so the $70 increase
Okay.
times the 63 would be about 5,000 increase for
So we
this.
got that straightened out
Yeah,
now.
yeah.
Got that. Okay. And that was it for now.
Okay, thank you.
Anyone else? Alderman Taylor?
You just said in your presentation how we strategically have stations positioned in our community for the best response time to the people of our communities. When we take vehicles, multi-vehicles out of our community, it puts our citizens at risk. And I think it's really important that when I was on the commission, Fire Commission, we approached the other communities, and Chief Aucture asked them what they would contribute to help offset our water rescue budgets and help pay for our equipment. And Town of Harrison, nothing. Town of Menasha at the time, Fox Crossing, nothing. Town of Inland, nothing. Yet we continued to respond to their communities and put our citizens at risk. And I think this year we should close that. The commission should come up with some numbers here, and we should move forward with these other communities and asking them again if they will respond. Otherwise, this is the bill that they're going to get from us. Where the towns are now villages, and they're competing with us head-on for the share of property taxpayers. Our borders are closed, and they have violated other agreements with us. And Alderman Sevedik has really pushed this forward about not paying for their anything to do with them, taking those off. Before, we had kind of a freewheeling thing, and if it's streetlights, they're going to pay for that streetlight. If it's snow plowing, they're going to pay for that snow plowing. And because they are our competitors now, and so things have changed. And I appreciate Alderman Sevedik continuing a watchful eye on this and pushing this agenda forward. And I would hope that the commission this year moves forward with this and help define agreements with other communities. So on any given day, we have one fire officer, one driver, and 2 firefighters per truck. Is that correct?
On a day that there's no one on vacation, correct?
So anytime we have a vacation, we're short on a truck?
If there's a vacation, then depending on where that person is, it can go down to 3 on a truck.
Okay. And how many stations does that drop to 3?
Yeah, so if there's 4 off, then it drops each station down 1 person.
So we're basically operating 3 on a truck. And the other one is to cover vacation time.
Correct.
The other day I was at a fire and I noticed it says command vehicle on it. How many command officers do we have?
So there's 1 command officer, shift commander on each shift, so 1, and then when that person is on vacation, then one of the senior captains moves up to that position. So there's 1 per shift.
Okay. And what is his job description, this command?
So his job description is, he is the one that coordinates the shift on a daily basis. He's the one that keeps track of vacations on the shift, who's off, calling for overtime. He sets up the stations based on his personnel. And then if there's a call, he's the person that is running the operation. If it's a structure fire or a water rescue, he's the person that everybody is relaying information to so he can operate the scene at a safe and efficient manner.
Okay. And is he used in a capacity of a firefighter too?
He is not.
Okay. And our police department has had a big turnover too. And in the past, we didn't have fire extinguishers in our police vehicles. And at the budget hearing the other night with the police department, I asked that question, and now they have fire extinguishers. Especially with their new staff, have we provided those individuals with fire extinguisher training on a vehicle?
That's a great question, but I don't think we have. But we do, there are several, maybe Assistant Chief Green can speak to it. I know we've done some training with some of our other city departments.
Well, actually, Chief Beglow has done it since you started. You did with 2 departments, right?
Yeah, excuse me. I have done it with the city of Menasha. They brought in new employees and we did fire extinguisher training. I have been in talks with the police department of setting up the training, and it has not gone forward. I have not received back any dates that they want to do the training yet.
And how about with our public works people that are out there with trucks?
They were part of the new employees that have come to this last year's training.
Okay, thank you.
And I know they have had training in the past with them as well.
On page 56, could you explain the automatic aid call review? And we have calls from Menasha to Appleton, and we have calls from Appleton to Menasha. Do we have a vehicle out of service or something, or what triggers this?
When we go to Appleton, they will respond for the most part with because that's the hardest area to cover for the city of Appleton, is that East Midway Road area, all the way even to Walmart, into that Highway KK, Calumet Street area. Typically what happens is when our apparatus goes into service for the city, we move up one of our vehicles over to Station 36 to cover. So typically it could be the Quint, because we have two apparatus at Station 32. Sometimes it depends on how long they're going to be gone. If it's a structure fire, then for sure we'll move up a crew into that station so that it's staffed.
Okay, and so actually what triggers that call? I mean, they don't have like, when they come to Menasha here, what triggers that call that Appleton would respond?
Yep, dispatch, the call is triggered by the location of it within our city, and with having CAD and closest vehicle response, that's what triggers it. And so if it's in that Midway Road corridor, again, I think it's anything north of 9th Street? 9th or 10th Street, then Appleton, the one that's off of Memorial Drive, would get called to that northwest area of our city. So that's, the triggering is the location of the call.
Okay, and is a fire inspector ever brought back, if we're really short or something, are they ever brought back in a firefighter capacity at ever?
Always. So if they're out doing inspections and we have a structure fire, they immediately respond to the scene. Even in EMS calls, if it's something where they're close to the call, or if it's somebody that is not breathing, or a major accident, or something that's pretty traumatic, they're gonna respond right from what they're doing. So they would be that fourth firefighter, or that fourth person on an engine, if that's how the shift lines up for the day.
If you have a shortage, you ever pull them back onto station duty?
They come back to station duty after the duty day, which is at 4 o'clock, 3 o'clock. They do come back to the station, and they are one of the firefighters then.
Oh, for a shift?
Correct.
Oh, okay.
Yep, and that's both inspectors. So during the day they inspect, but after 3:30, 4 o'clock, then they are part of the engine crew.
Okay, I thought they were like a 7 to 3 separate of the,
No.
okay. Okay. I'll probably have something more later, but I guess we're going to walk through the pages now.
Okay.
Thanks.
Thank you, Mayor. I just wanted to kind of piggyback on Alderman Taylor's questions about the mutual aid that we have with the city of Appleton. From my experience being on that committee, this has been a truly outstanding intermunicipal cooperation between two communities, and where two taxing entities are providing the best type of service for the dollar. A lot of that area is in my district, and some people are puzzled when they see an Appleton fire truck show up, but as the chief explained earlier, it's based on geographics basically. And when it first started, I mean, we shouldn't look at it this way, but when it first started, Menasha really benefited from it. And, Appleton actually benefited from it, and now Menasha does greatly, because we get those reports to us monthly on the number of calls and stuff, and a lot of them are first responder type calls. If you're familiar with the Midway area, with some of the housing with people who are 55 and older that live in those areas up there, often have several EMS calls, and it has really benefited the city of Menasha. And this is one of those situations where you see two communities actually working really well together, instead of trying to maybe build another fire station so you have better response times. So I've always had a pretty positive feeling about that program.
Oh, I know what I was going to say. There's a lot of paper here.
Yeah.
And I know you're trying to save ink, but I can't read.
I know. If you would like, I did this for the NINA Council. I sent them a copy of the PowerPoint. I just thought as we went through that, if you wanted to take notes on those slides, you could, but I will send each of you a copy of the PowerPoint so that it's probably more easily read.
I appreciate you saving ink, though.
Thank you.
Seeing no further questions, Thank you guys for coming tonight.
All right,
Appreciate
thank you.
it.
Thank you all.
You're finished? If you want to, we can, but I asked if there were more questions, so if you have questions, if that's what you want to do, Alderman Taylor, we can definitely do that. I've walked through the pages, I've asked the chief my questions, you guys have the opportunity to ask your questions if you have specific questions. But, so if you have questions, this would be the time to do it. I'm sure the chief would be happy to answer those questions later if you come up with some other ones as well.
Absolutely.
Okay,
I
everyone?
do have one more thing to
Okay.
just kind of add, and let me find my page here before I go on. Well, anyways, I'll just have to wing it here. I just want this body to know, as a member of that committee, I have had issues with our formula, and that our committee is now exploring different, and when I mean formula, how much both communities pay towards this budget, so that. Which one was it? 64. Thank you, Ted. So we'll be exploring that, and I had it there before. We'll be looking at that further. I might be opening up a can of worms. Menasha might end up paying more, but I just never agreed with the formula. It was never looked at since consolidating these two departments. It was basically just assumed that this was the appropriate way of handling it, and the way I see things just on the onset is that we've lost the number of industries. A lot of those buildings are gone. We don't have the square footage as we used to. Industry fires, commercial fires, to me are different than home fires. They involve so much more, and population just isn't a good factor to me. So our work over the next year will be exploring that formula with the possibility of having something that would be maybe more equitable for both communities.
Alderman Taylor, did you have something else?
Yeah, I had some stuff written down on the pages here that I went to. I thought we were gonna, but I was on the Fox River at Jefferson Park watching you respond one night to, it was a call of maybe somebody needing help on the water. And the tools I see you working with out there, at the time, I thought was adequate. A flashlight with a boat, and I've been a boat owner my whole life, and a flashlight on the water isn't, or a spotlight, isn't the best thing in the world. You get so much glare from the water and everything. And as technology presents itself, I certainly, at all levels of this community, all budgets, I'd like to see us embrace that. And with the imaging cameras and the infrared cameras and the drone technology getting better all the time, for someone that's in the water, I think a drone with a infrared and picking up that infrared signature of somebody floating in the water or anything like that would be just a great tool. And the amount of area you could cover is just outstanding, rather than in a boat trying to see somebody that might be submerged recently or something. So,
Sure.
Has your department looked into that at all?
That's a great question. We just had a citizen that has come forward, and he witnessed the tragic boat accident towards the end of summer it was, where the two boats collided. And he took on the task of trying to raise some money for our water rescue to improve some of those piece of equipment that you just explained, Alderman Taylor. And one of those is having an infrared, some type of infrared vision that they would be able to use at night that would pick up those heat signatures. And then we've been working with the police departments. I know Nina has a drone that they have now. Actually, Assistant Chief Green got his pilot's license for flying a drone, so that's been in the works to start training together to have that capability. But I was very happy with some of our committee members for our water rescue team had spec'd out some of those FLIR or night vision goggles to, just like what you said, because sometimes flashlights just don't carry far enough, that the night vision would be able to help us dramatically with the help of the citizen. So I think to date, he's raised somewhere around $4,000, and then he actually has a couple events on the lake, where they walk across the lake. I don't remember what that is called. They're gonna donate the funds from that event, and then there's another ice fishing event on the lake that they're gonna donate some funds to help get some of that nicer equipment that you described to help try and locate somebody quicker, sooner. And it would work really good in the winter time, because there's several times we're out looking for snowmobilers, and to have that FLIR or that heat image would be very helpful for our crews.
Well, we certainly know in Menasha, Nina, a lot of the accidents in the wintertime happen near the mouth of our rivers. And where I see your boat go out, but I see the crew also on the banks of at the boat landings or whatever.
Yep.
And I thought it would just be a wonderful opportunity to have that technology to help direct those guys too. Because in the black of night, sometimes, you can't see much.
Correct.
So-
Yes, thank you.
Okay. Keep on working on that.
Yes.
Alderman Rapella.
Oh, thank you, Mayor. Kevin, on page 62, I was just looking at your capital outlay.
Yes.
And knowing that most of the expense for the fire department is with salaries and with benefits. Let's see, the 8133, where it says all other equipment, these funds are used to replace major equipment relating to such nozzles, adapters, hoses, ladders, large equipment, $20,000. Is that something that's on a continuous every year basis, or has that been raised up lately, or?
That has been the same for several years. We've been able to maintain that amount, and it's nice. It's kind of like our truck schedule, where we try and not to purchase $20,000 worth of stuff, one item. We try and if it's hose, while we're hose testing each year and there's a couple of hose that needs to be replaced, we don't wait to 20 hose need to be replaced. We replace 2 or 3 so we've been able to keep it at that level for the last, at least since I've been here, and I'm sure it's been the same. I think it was the same prior to me being chief as well. So at least for 3 to 4 years, that number's been the same.
Do we ever get a list of the things that you are purchasing for that $20,000?
What, excuse
Do
me?
we ever get a list of the things that you are purchasing over the year for the $20,000?
Oh, we can certainly provide that. Again, it's some of the larger equipment, nozzles, hose. Is turnout gear come out of that?
No, but anything over $10,000 gets reported through the PO system.
Yep, so yeah, if it is over 10, it gets reported through PO. And that's one of those areas too, that if there's funds left over, that's an area that gets turned back in at the end of the year.
Okay, and one more, the household purchases, right below that for $9,000 to replace the washers and the stoves and dryers and things like that. Again, is that a set cost, $9,000 every year?
It has been a little less than that over previous years. It was raised a little bit this year, and that's due to, I think, the quality of some of the products, the dishwashers or the washer dryer, just, where they used to last 10 years, they last 3 if you're lucky. So, again, we try not to purchase a ton of stuff in one season, or in one year. We try and, if this station needs a replacement, we get it, and then, so that it's not purchased, 2-3 times in the same year. It's kind of leveled out, so it's not all one at one time.
Okay, thank you again. Thank you
You're
very
welcome.
much.
Sorry, I turned you off because I turned you off too.
Thanks, Mayor. Thanks, Mayor. In our water rescues in the dam area here in Menasha, there's a safety cable out there, and I'm out there 3 times a week at least, and I notice that cable it's bolted to the bridge and also anchored on the point, and it seems to be getting lower and lower in the water. It's accumulate tremendous amount of seaweed, and I don't know who's in charge of that cable, but for the safety of people that may have to use it and for the safety of your department, I don't know who we would inform to check that.
Yeah, that's a great question. I have no idea who monitors that. I don't know if that's the Army Corps or if that's something the city had put up at one time, but I do not know who keeps track of if it's stable or not or anchored properly.
At some point, it's going to fail, and I would hate to see that happen to anybody, especially to our department or something.
Sure. If it's Army Corps, we can check into it and make sure that it's properly, somebody checks on it, or if there's some kind of certification or something, they come out and look at it on a yearly basis, but we can certainly check into that.
Because the point where it's anchored to also is collapsing constantly.
Right.
All the stones caving in.
Sure.
And I was going to say this at the start, for all the budget people tonight here, and we said this on the first budget, we need to reduce $113,000 out of the budgets to bring the taxpayer to a 0 increase on their taxes. So we're looking out for our bosses too that put us here. So overall, it's $113,000 through all the budgets. So if we can reduce that and have the taxpayers have no increase, that's what we have to get to. So just to let you know that too, that we have the bosses too.
See. John, did you?
Yes, I just wanted to add a comment to what Alderman Severnick had said about the formula. Back on page 64, I inherited this when I got here, and I have worked in a previous environment where we had a metro fire department also with 2 communities, and we had used another factor in the formula, which is a little bit different than what you have used here. But what was interesting to me was that when you look at the equalized valuation component, which is 1/4 of the formula, on the Menasha side, you add in UW Fox Valley for $40 million, but there's obviously other property that are nonprofit and churches and exempt properties for hospitals or medical centers that are not taxable on a tax bill, but yet it's valuation that the department is protecting within the city. So that's something that Finance Director Easker from NINA and I talked about just briefly, and we've been instructed by the Committee of Joint Finance and Personnel to look at this in the first quarter of next year as looking as part of the factors, and the equalized valuation is one of them. Why do you include one nonprofit or one taxable or tax-exempt entity, but not others in the formula? And then the other factor that was listed right on the sheet on page 64 is that you used to use 5 factors. One of them was square footage of buildings. Well, what I learned when I was at the meeting a couple weeks ago was that it was discontinued, that factor was discontinued out of the formula because it was hard for one of the communities to not be able to provide up-to-date square footage numbers where one community could and one was not able to at the time. So I kind of want to explore that a little bit more about that, since I'm still learning how this has evolved over time with the formula, just to try to make it as fair for both communities going forward in time. So it's something that we will be planning on doing something after the first of the year and looking into it, because the committee would like a report back, I think by the end of March is what they were looking at, by end of first quarter. So stay tuned. We'll have more to report in a couple months.
Okay. Seeing no one else, let's move on to the Health Department then. Thanks.
Do you know how I feel
Did
about
you
the
hear
health
that?
department?
Did you hear that
So-
comment?
Good evening, everybody. Thank you so much for having us at this budget session. I'd like to introduce Christine Jacobson. She's a public health educator that joined us this past year, and I've been thrilled to have her with us. She's doing a great job, and she did help to do some preparations for the budget. She's done some work with us now in the few months she's been here on performance management, which is great. You'll see some of that scattered throughout the presentation I have. And as I've told you in the past, I really enjoy being with the city of Menasha. I think that this is a good career move for me. I've really enjoyed working with the staff. It's a great staff of professionals. And so I just wanted to give you just an overview of the health department. Again, we're a small sliver of the budget, about 5% of the budget overall. We are a level 3 health department designated by the Wisconsin Department of Health Services, and that's the highest level that you can have for a health department. Our mission is to work in partnership with the community to protect and promote health and safety. Our vision is a safe and healthy community, and this year we worked on our goals, and we really have an overarching goal to improve communication, promote services, and share the results of our work with you more than we have and with the community. I think Christine will be a great asset in that goal. Our professional team basically is myself, public health director. We have 3 public health nurses. We have a school health aides, a registered dental hygienist that works full-time in the school district, a dental assistant, screeners. We have a sanitarian, public health educator, Christine, and a program assistant and a translator. For a total of 9.86 FTEs. So we have a lean, mighty team, and we do a lot of cross-training with that team, so everybody works together. We have many programs in the health department. All of them are supported by grants, contracts, donations, inspections, and licensure fees. So I constructed this a little bit so that you could follow along in the budget book. Make sure that I have everything here. And so if you turn to page 39, that's the first budget for our Employee Safety Committee. And just a couple notes. I want to let you know that that safety committee is health department managed. It complies with all of the Department of Safety and Professional Services and OSHA regulations. We want to assure a safe working environment so that everybody works to their optimum ability. We conduct our respiratory fit testing and organize hearing screening for both the health department and for Menasha Utilities. We investigate all injuries, and we conduct monthly safety committee meetings. This year we had some major accomplishments I'd like to share. They're numerous, and I selected a few out of each of our programs so that you could see just a smattering of what goes on. But this year we developed drug-related incident procedures. So, for example, our police department, who responds on the scene of an event, needs to be protected and also have procedures in place for evaluating the scene and proceeding. We also provided training to avoid drug-related occupational hazards. So along with the personal protective equipment and along with the procedures, we had training. And Todd Drew, did work with Ymca on developing a webinar. And a webinar was entitled Protecting Municipal Employees from Opioid or Fentanyl Exposure. And this was seen by over 70 municipalities. And it's really quite amazing, and they did a great job. It is a cornerstone of a grant that we're applying for right now through the Department of Health and Services. We would like to reformat this and make it an actual online training that people can access and use on a regular basis, like an annual training, and kind of integrate it into our safety practice. Budget changes this year, we're similar This program is funded by tax levy. We do leverage the CIVMIC grant for supplies. Our objectives this year would be to work on developing our safety manual or revising it. We want to make sure we focus on reducing and preventing injuries, and again, leveraging that DHS grant. I'm very optimistic that we will get that grant, as well as the CIVMIC grant. So one change we did make this past year was our personnel. It is a 20% FTE that manages this program. 15% FTE is Todd Drew, the sanitarian, and 5% is our public health educator who has training in doing respiratory fit testing and obviously public health education. So we're happy with this. Okay, the next program we have is the Sealer of Weights and Measures, and that's on page 74. And that is inspecting businesses, their devices for consumer protection. So you're ensuring that people who are purchasing goods and services are getting the value that they're paying for. And this is required by statute for municipalities that are 5,000 and over. And so our major accomplishments there were, we have had some larger businesses, thankfully, that have come into our community, like Festival Foods, and we're really noticing that we're inspecting a lot more devices. We've had 17 complaints that we've responded to, and there has been mandatory continuing education that has been completed by our staff to be able to go out and do the inspections. The budget changes are similar, and this is funded fully by licensure fees, and our objectives would be to continue to complete inspections and also respond to complaints. Again, the change that we have is it's a 0.2 FTE, and we are shifting a little bit with 15% being our public health sanitarian, who is also our sealer for the city, and giving the FTE 5% to the public health educator, and she is working with Todd on pricing. So it's something that she can do with Todd as the sealer. The next one is the health department budget, and that's on page 107. And again, as I said, we are a level 3 health department, and we provide services for the Menasha Joint School District, school health nursing services, dental hygiene services, screening, and education. We also do public health services for the city, which includes communicable disease follow-up, maternal and child health visits, home visiting, education. We convene the Board of Health, the Committee on Aging, and the Medical Advisory Board. We provide all the CPR training for the Menasha Joint School District and the city. Our major accomplishments this year is that we completed over 4,500 screenings. We completed nearly 1,400 school nurse encounters in the school year of 17 and 18. We followed up on 172 communicable disease cases. We're already up to 177 year to date, so we think we're going to be exceeding that. We've done 62 home visits in 2017. We don't have data on that yet. We have done about 400 vaccinations during our monthly vaccine clinics. This year, and you'll see it reflected in our budget, we have administered 356 vaccines just at our annual influenza clinic. So we have people coming in and getting influenza vaccines, but we also, during our mass flu clinic, which is also a preparedness exercise, have seen a lot of people, and that was a 25% increase over the previous year. We also provide vaccines to local businesses. We provided about 225 vaccines to people in local businesses, which is a 27% increase over the previous year. So we're seeing quite an uptick in influenza vaccines. We also do, again, I mentioned the CPR first aid. We saw 174 employees. And we added a session in the winter so that we could capture the public works folks prior to them getting busy in the summer. So we're pretty busy year-round. About 99.8% of our school children in the city of Menasha comply with our state immunization law. So this is good news. We completed community health assessments this year, and we'll be reporting on that and making plans in the following year. The budget changes are similar. Again, we're covered 50% by tax levy and 50% by the Menasha Joint School District. However, we do charge medical assistance for screenings that we do, and we also do charge for vaccines. So, and we have grants, various grants. So, for example, last year you approved the ability for us to purchase a pharmacy-grade fridge for our vaccines, but we were able to buy that through our bioterrorism grant. So that saves the money for the tax levy and for the school district. Our personnel here, we have one program assistant, myself, the public health director, our public health nurses, we have a Hispanic interpreter, and a dental hygienist, and a public health educator that have some level of funding out of this grant.
Before we move forward, it looks like Ted has a question.
Oh,
Yeah, just
sure.
me being an accountant. An accounting question on page 107. You have your 2018 year-to-date actuals. What, is that through August, through July, through September?
Our actuals at the time, I think, was October.
No?
That would have been September. Late October?
Mid-October.
Mid-October.
Oh, so it's not a clean cutoff for a month or
No.
anything? Okay. So wait a minute here.
Yep. And you'll see this coming year, as I said, when we got into the influenza vaccine season, we had to go and purchase additional vaccines. So it's going to be a little spike in that. However, we charge for those vaccines just a little above cost, and then if we have any extra, we can send it back. So the city recovers it. We aren't going to be charged extra for that.
Alderman Taylor also has a question.
Yep.
Under, about three-quarters of the way down on 107, tools and equipment, and I believe it's $2,300.
So you're wondering what we're doing with the tools and equipment? I believe that equipment is infant CPR. We do CPR and we need mannequins, and this year we need to purchase some mannequins.
Okay. And then the next one down, department. What does that mean?
What is the budget number?
Right below tools and equipment.
Department. That is
Yep.
where we purchase our influenza vaccine from. And so we made provisions to purchase additional vaccine. But as I said, we will not be, if we don't use that vaccine, we can send it back. If we do use it, we get paid for actually administering vaccine at cost or a little slightly above that.
What type of vaccines? Variable?
Pardon me?
What type of vaccines?
This particular one, there's two things we purchase here. Tubersol, which is the TB skin test, and then the other thing we purchase is our influenza vaccine. It's that we administer at our flu vaccine clinic.
And do we charge anything for those?
We charge $17 per influenza vaccine, which is nearly cost, but we do add a little bit for our staff time.
Okay. All right, thank you.
This is the Health Screening 60+ program, and that's page 113. Whoops, sorry, I missed environmental health, thank you. Don't want to miss that one. Back it up. There we go, we're on 110. So we are an agent for the state for the Department of Agriculture, Trade, and Consumer Protection and the Department of Natural Resources. And what that means is that we are qualified to do all the inspections for retail food, for swimming pools, for hotels, for rooming houses, for various school food services, mobile home parks, those types of things. We also inspect for asbestos and in commercial buildings and demolition, and I think that you have seen that benefit when Mr. Drew has been able to help the city in evaluating risks and hazards. We do human health hazard investigation and vector control, odors, and, those kinds of items. Our major accomplishments, there are a lot this year. We have been very, very busy in that area. I'm just going to list a few things. We've collaborated with Menasha Utilities on the home-led risk assessment database. We have done 419 inspections and human health hazard investigations. We followed up on 28 dog bites. We initiated the Bridges of Fox River Consortium between Menasha and De Pere. I just want to mention that that's going very well. I know there's been concerns about making sure that our sanitarian is keeping to the hours that we agreed upon in the contract, and we've been very careful about that. It's mutually beneficial in my estimation, because if something were to happen, if we had a bigger event, a larger scale event, or if we needed backup for Todd Drew, we would have that backup through this contract. Todd has completed certifications in lead risk assessment and lead hazard investigation. This year, we belong to a group called Health Emergency Response Coalition, and it's all the healthcare systems and also the health departments in our region. And Mr. Drew went to a training called Go Team Training, and it's physicians and him. He was the only environmental health person, as well as public health nurses and nurses that work within health systems, to train if there happens to be a catastrophe in our region, to mobilize in a quick manner. So that was very good. He's also attended FBI training and advanced hazmat life support training. He's presented a few times this year on food-related emergency preparedness, and he's actually led exercises on the state level. So it's a well-recognized program that we have, and I think we're doing a great job in our community, as well as leading the state in some of the innovations that we've done. There is an increase, as you know, in this budget, and part of that is because we shifted Todd's time from the safety program and the weights and measures just a little bit onto environmental health to assure that he has time to do his work. And last year he worked, we allowed him to work up to 40 hours per week, and he's consistently doing that. So now we've made it 40 hours per week, because that's what it takes to do his job. So I think that's the change that I see in the budget. Our objectives next year are to complete inspections and health hazard investigation, maintain our contracts with the FDA and with the consortia, and this is a .70 FTE position. Any questions on this one? Okay, now health screening 60 plus. That's page 113. Just a couple things about this. I've been just amazed by the public health nurse that we have that is working with our senior center, and this is funded by a grant through Winnebago County fully, and she has just managed to work with the community healthcare providers to get skin cancer screenings, oral health screenings, hearing, vascular screenings, medical laboratory tests. They offer Tai Chi, which is a balance program, along with stepping on classes, healthy living with diabetes, which filled up to capacity, ask the pharmacist, blood pressures. So there's a lot going on, and this is in collaboration with Menasha Senior Center. So as a result, and she works 22.5 hours per week. So this is a lot of work, but she's doing a wonderful job. 1,288 people received 1,190 health services. Again, we are looking year-to-date. I think we're probably going to exceed that. 989 people have already received health services. So we're looking at making sure we complete the trainings through the end of the year, and then we completed a needs assessment this year that guided our Committee on Aging strategic planning process. So she's done a lot, and we worked with UW Oshkosh nursing students to get some of this done, so it's been a good collaboration with our UW system. We are starting to track our programs, and I mentioned performance management and doing evaluation, and Christine put these slides together for us, these graphs together for us, so we can actually track programs by month and kind of look at what's been happening from month to month and what we can do or how we can explain why we have better participation. I want you to kind of take a look at that bottom slide. That's a Lunch and Learn, which is a new activity that we launched this year, and it's just getting people together around health topics and really discussing things that concern them. And if you look at November's, it's a big spike, isn't it? Well, that was Josh Ramdowski, I can't say his last name.
Radomski.
Radomski.
That's what I said the other day. I got everyone confused.
Well, he smashed the record, and Josh, and guess what his topic was? Anybody know? Yes, the inverted diamond. So he did a great job, and the seniors, really enjoyed that, and it was very helpful for them. And so I think it's kind of interesting, and you don't think of that as a health and safety issue, but it really, really is.
He came back and said he would do it again. He was very intimidated before he went and did it, and said everyone had great questions, and it turned out very well.
Yeah, he's very popular. He did a really great job, and I think it really helped a lot of people feel a little bit more comfortable about it, because you could surely, avoid that traffic if you had to.
So Alderman Severnick has a question as well.
Yes.
I didn't hear what the topic was.
Diverging diamonds.
Inverted diamond,
gotcha.
the traffic pattern, yeah.
So that's why you did a
over
good
on Oneida
job
and
with us. You had a little
441.
practice, huh?
Exactly.
Actually, my question is about participation.
Yes.
And of course, my issue is always providing service to outside communities. How much of this is City of Menasha?
We're studying
How much
that.
is-
I mean,
yeah.
we are studying that.
Here we are again,
I don't have firm numbers for you. I can try.
Yeah.
But
That's important
what
to
we
me,
what
and
we
I think
did
all of us.
institute this year, which is very good, is when we have a screening, for example, we can now set them up online, and then we ask, where are you from? So we get an address. So we'll be able to track some of that for you and give you
So
some
when you're talking about,
information.
I was talking about some of these 60-plus programs, but also too, even the, I was here I had a meeting here at City Hall, and the line was out the door for,
Thank you.
There's a program that we're going to offer next year that we've looked into, and the Y did approve the cost for it. It's called Schedule Plus. A senior member would walk into the building, they would scan their card, they would put on there, it would automatically come up with where they're from, what they're doing, and then it would tell us exactly what programs they're going to do. And
So
it
that's
is
for the
sched-
senior center.
Yeah, that's for the senior center. So if they're coming in there for a health screening or lunch and learn, we would know how many Menasha or people are in there, how
City
many
Menasha.
Appleton, how many Oshkosh, Fox Crossing,
Right.
that kind of stuff. It's due to come in, I'm meeting with the person in January and setting it up to go live in February.
So I'd like to introduce Cheryl Richards from the
just
Menasha
working on
Senior
this.
Center, and she is with the YMCA, and they're contracted to do our operations at the senior center, and she came tonight to lend support and
It's one
and
of the things
explain
that I
things.
wanted to do since we started.
But I think your point is even broader than the
Yeah,
senior center. I
but-
mean, we could be
right, but
measuring services.
Senior center is probably the biggest one.
Yep.
But also too, I just wanted to, in a way, compliment you too. It was that day I came in here for a meeting, the flu shot clinic that you had. I'm not
You can join
exaggerating.
us up front if you'd like.
It was out the door, yeah. And so when I saw your numbers up there, then
And that was from between 2 and 6 o'clock.
That's
So
all.
we were clipping along, but I mean, that is a collaboration. I think I've shared some of this with you before, but to work with the UW Oshkosh nursing students every fall, they get to rotate through and they have a station and we closely monitor them and their instructor is right there with them.
I like
But we had
that.
4 stations going all at once and we were busy. And actually, Christine organized it this year as this is a public health emergency preparedness role also, because this is our exercise. So it's a combination of all these factors working together. But I'm glad that you were able to see that. We were pretty tired. But it's a great
I'm looking
collaboration.
forward to seeing what communities are sharing our health department and our senior center.
Well, at least with the vaccines, they are paying for the vaccines too. So, we do have that. I do want to mention with the screening, there is one screening that I really appreciate, and that is the vascular screening. We have identified people who would have been at risk of severe health consequences had they not been screened. So it saves lives.
The other thing with your program, I hope you realize that there are a number of people that live in the town of Harrison that have a Menasha address. There are a number of people in Fox Crossing that have a city of Menasha zip code address. So it won't be so simple as to say, yeah, we had this many from Menasha. You're going to have to base it on probably even the voting polls or the voting registration list, because that's,
The library already does do something very
and
similar.
there
They-
you go, there's
they
someone to
clone it down.
collaborate with.
When I set this up, I can talk
Yeah.
to Joe from the library.
Excellent.
Okay, so we'll, everybody okay? We can move on to the radon prevention. You're next. How did I get to radon? This is like 2 in a row. There we go. A prevention program. This is a unique partnership too. We work in partnership with businesses to run our prevention program, so, and with our departments here at the city to promote outdoor physical activity and nutrition. Our major accomplishments this year, we're a part of the Way to the Fox Valley leadership team and subcommittees. So we work with all adjacent health departments, as well as businesses that are interested in health for their families and for their employees. We secured funding this year for a community dialogue with older adults to inform our state health plans. So we actually have a mini grant that we're going to work on through the winter and next spring. Actually, there'll be a great role for Christine. She's going to facilitate her training paid for by this grant, and we will be able to inform the development of our state health plan, which is great. And I think we're the only grantee that focused on older adults. And to me, it's a natural because we're all getting older and we're expecting longevity, and it's going to affect the way our health system is impacted. We also did the Corny Community Walk through this grant this year. We had 250 participants, and that was up 27% from last year. It was at Jefferson Park, and it was really well attended. And that's again, a great collaboration. Fire Department, Police Department, Health and the Human Resources Department here, Menasha Utilities, I believe, is the Park and Rec. Way to the Fox Valley, area businesses all contributed to make this a success. And so it's been very good, and it promotes your place on the water. So that is, one of our focuses. The budget increased slightly because our grant increased slightly this year. We're going to facilitate the 5th annual Corny Community Walk again, and we're going to work on our community health plans, and the personnel is our public health educator, just 5% of her time. Now the Radon. Patrick, I might need you to help me get the Radon awareness website up. Radon was not funded by a grant this year. It was funded by a donation, and it was very much appreciated. And what we did is we worked on developing enduring content, which means we took our PowerPoints and made sure that we reviewed them so they were accurate, and then we also translated them into Spanish. So we have that now, and if you want to scroll down, you'll be able to see in PowerPoint. And it's called Enduring Content. If you can scroll through it if you want. But it takes a lot. But we do have this enduring content in Spanish now, so that everybody can have access to this kind of information. It's no small task to get this done. And I think we're on page 12.
Do we get grants for putting that in Spanish? Is there something to help us with that?
We have on staff just a very small amount of time for a translator. However, this dedicated donation was able to pay for the translator to do this for us. And we were able to also purchase Radon kits. So now we have a rotating, you come in and purchase a kit at cost. So we're able to give people Radon test kits as well.
For the public listening to this?
And their public listening.
What is the kit?
$6 per kit. Yep, and it can come to the health department, and if they have questions, we can offer technical assistance.
Okay, and I know you might be getting to it, but do you still have the water filters too?
Yes, we do. Yep, we're getting there. Yep.
I know you will, but while I was here, I had to say it.
But this, again, is not funded in 2019, so it was really good that we were able to get this enduring content up and to offer those test kits at cost. So we appreciate that. Okay, next area we have is
To the computer.
oh, the computer, okay. The next one we have is the health aides, and I'll just launch right into that. The health aides are under the direction of our public health registered nurses at the schools, and they do health-related services for children, for example, passing out medications, responding to accidents, illnesses. They're an integral part of our team for school-based nursing services. They are similarly funded next year. They are fully funded by the Menasha Joint School District, but we do have oversight by contract for that. We have about 1.38 FTEs. They work about 15 hours per week during the school year on this. Any questions on that one? Alderman Taylor, did you have a question? Do you have a question? I just saw your light on.
Oh, I'm sorry.
No, that's okay.
Your book
Just
probably.
didn't know if I was missing it.
Do you think we're getting our fair share with the school system paying for this?
I think we have a wonderful arrangement with the school system, and I couldn't be happier that we're located here, because we can work directly with the administrative staff on issues like immunization records. We have access to their translators and interpreters here too for school-related items. It's been a good collaboration overall, and I think really works best for both the health department and the city and for the school district. So I'm very pleased with our arrangement.
Just making sure we're getting paid, right?
Yes, we are.
Thanks.
Yep. Page 122 is our dental program. And the Menasha Seal a Smile program is one program that does sealants, and then the other program is this dental program that does work with children to do oral screening and provide fluoride varnishes. Our major accomplishments are we saw almost 2,000 children for oral screenings last year in the schools. About 1,400 had topical fluoride applications. About 196 were referred for early and urgent dental needs. And then we saw almost 1,800 kids in 89 classrooms for education. The staff in our health department is trained by United Way now to do results-based accountability, which is looking at not only the numbers of people that you see, but how does it affect their quality of life, and how does it translate into being cost-effective for families. Our changes, well, actually, it's a United Way grant. It's fully funded and has increased. They have an incremental increase. It's funded through 2020. Again, we're going to offer the oral health services that we have in the past. And we have a .68 FTE dental hygienist and a dental assistant, a .48 FTE dental hygienist and a .14 FTE dental assistant. So the assistant helps the hygienist. This is one of the programs I want to mention that UW-Oshkosh uses as a rotation for their nursing students, and we also have the dental assistant students from Fox Valley Technical College. So it's a learning environment too.
How does one become a patient or whatever for this? I mean,
This is
how
open
does
to all
one
children
become
in the Menasha
one in
Joint.
screening? I mean, how does one determine that? Is it a parent that comes to you, or is it a teacher, or how does that come about?
It's an opt-out program, so the Menasha Joint School District offers it, and if a parent doesn't want to participate, they let us know.
Okay,
So it's every child is screened.
every child is screened then? So that's why those numbers
And
are
the
that
fluoride
way.
varnish and the dental sealants are by permission. And generally, if somebody has dental assistance, they opt out. Dental insurance, they opt out. This is what the fluoride varnish looks like. It's actually a coating that works on the smooth surfaces, and then the sealant works on the pits and fissures. So you have really good protection against tooth decay. And then this is some program outcomes that we've been tracking for the last few years. I want you to take a look at the green lines that are jutting up. Okay, so what we started to see in 2005, this is before I got here, is a spike in tooth decay. And generally in populations about our size and our income level, you would see about 25% of the kids have tooth decay. Well, we were edging toward that when they just had a screening program. So in 2009, they introduced a fluoride varnish program. In 2010, they introduced a sealant program. Those two together prevent tooth decay, and you can see the dramatic drop in the number of children that have tooth decay when we did the screenings. We're not satisfied with 10%, even though that's pretty remarkable. We'd like to see no, zero, but, so we're always going to work on that outcome. But I think this is how we're tracking these measures, and we're working with United Way to be able to do that and tell this story a little bit better. When a children has tooth decay, they have a very hard time concentrating on the learning process if they're in pain and suffering. Okay, communicable disease.
And
This is,
I had a question. In the
Sure.
dental program, I don't see any charge for a vehicle in
is
that
this in the
column.
0909 budget?
Page 122.
Okay.
Are
And
we charging the school system for our vehicle use too?
I don't see vehicle use listed. They, pardon me? It would be under mileage is what she's saying. So it's very low mileage since we're right in the city.
Okay. And
And I think because our dental hygienist that arranges she's a registered dental hygienist that does the screening and the fluoride treatments and the dental sealants, also arranges all of the health screenings. So some of her mileage could be in the health department area too.
okay. And do we still offer the guitar playing, singing dental hygienist program?
No, Loretta has retired.
Yeah. But
And,
that didn't get carried on, huh? That's not a
We
requirement?
were sad to see her go, but I have to say that Claire Opstein, our public health dental hygienist, is awesome. She does a great job with the children.
Okay,
And she's actually been in dentistry for many years, so she's very well experienced.
Thanks. I was just kidding.
Yep. Okay, communicable disease. This is a new grant that came in this past year. It's general purpose revenue funded, and basically it helps us to work on communicable disease control follow-up and then also to do outreach and education. It's a very small grant, but it has helped to get our prevention messages out there on social media, and also to follow up on some of the cases we've had this past year. Latent TB, for example, and TB follow-ups are very time-consuming, so this does help, offset those expenses. We do have our public health educator funded by this partly, and again, state general purpose revenue. And this is a new grant, Lead Free by Delivery, and we were successfully awarded this grant this past year, and our goal is to prevent childhood lead poisoning. Our major accomplishment, of course, is securing that grant. It was very competitive. We were one of 8 that were funded, and there were, I believe, 28 applicants. So we did a good job on that application. I have to thank Christine for helping in a major way. We're going to enhance the lead database. We have selected a site, and they've agreed to assist us, Partnership Community Health Center. We are happy to say that we have a capstone project from a UW Oshkosh nurse practitioner student intern. She'll be actually with us as a student intern through May 2020. So we're very happy. Even after this project ends, she'll be able to help us keep on institutionalizing what we learn and what we gain from the project. So we're happy about that. Pardon me? She is going to have a stipend out of the grant, so it's a small stipend from the grant. Our objectives is to get the lead hazard database publicly available. Right now, it's available to us as staff, but we're working with our web designers for the city website and getting that up and running. Our second objective is that women who are pregnant or contemplating pregnancy will receive lead hazard education, and then offering technical assistance through our environmental health specialist, and then water filters if their homes have galvanized or lead pipes. We obviously have, the nurse practitioner student that's working on this along with Christine, public health educator. It's fully grant funded. This is our lead poisoning prevention grant. This is a very, very small grant, and this is on page 128. And this is a long-standing program. It's basically monitoring and taking in the results of lead testing through the State Lab of Hygiene and physicians' offices. And we review all of the reports from the labs and then offer technical assistance, and then also reach out to the families depending on what the blood lead level is. We do offer home visits if there are elevated lead levels so that people can look at all sources of lead and try to mitigate them. The grant is similar to last year. It's funded by a DHS grant, and we provide those services in accordance with federal and state guidance, and this is a .04 FTE public health nurse. Immunization grant?
I had a question on
Sure.
the lead. With our water lines, we try to change those over, get the lead out of our system. But, we have 40% rentals in the community, and we're not addressing the whole problem. And now you have a house that's completely galvanized pipes, lead pipes. And is there anybody that's looking at that at the federal level or state level, or, we're not taking care of the problem completely? And how do we identify that, and how do we look at that?
Yeah, I think
Especially
that's,
with all the money we're going to spend on this projects.
yes. Well, I think you raise a good issue that 20% of the problem is lead pipes. The remaining 80% is paint. And the lead-free by delivery grant is looking at all sources of lead, and it is very expensive to mitigate those sources, and we will continue to seek resources as much as we possibly can to help families. But you do make a good point.
I just don't want people to have a false hope that
Right.
we're spending all this money out in the street from the water plant to their home, and then
I think our goal with lead-free by delivery is to move off the getting reports in when a child is a little older to moving toward educating physicians and nurses and those people that encounter people who are contemplating pregnancy or are early in a pregnancy to try to get their homes lead-free by delivery. That is the goal. But you are right, it's quite expensive when you have, all of those issues going on.
is there anything with Health and Human Services that a lot of these people have very low incomes, they're renting, and a lot of the older rentals, is there any type of initiative to have like a lead-free home that somebody knows when they're moving to that home or anything through Health and Human Services?
That's a huge policy issue. And the reason it's a
Well, I
policy
understand
issue
why.
is because the EPA, regulates and requires the landlord to notify renters that there may be lead in the home, but it doesn't require them to mitigate it.
Okay.
And so, as policymakers here, I think we do need to start thinking about this and finding ways to change that.
Yeah. And it can't be funded on the local level, it's got to be.
It's very difficult.
It's got to
yeah.
come from the federal level before we can do anything at this level here too.
And it's not just a problem here, it's a problem everywhere.
But I was just wondering.
We're just doing a lot more about it. But I feel like you, that I wish there were more things that we could do.
Well, it'd be nice if if there's even a certification level that somebody can get at, and it's a selling or tool, saying this home is a lead-free home too. So it would be nice that some policy would move forward with something like that. At a much higher level than us, but
Yeah.
it's good to have your input in those. You
No,
attend
thank you.
conferences.
Thank you, and I think we've had a lot of discussions about how this would save societal costs.
Thank you.
Just like to comment, Director McKinney and I and
Sorry.
Alderman Nichols and a few other people, when we started talking about the lead pipes issue, we immediately realized that this wasn't just a water issue. It's a paint, it's a soils issue. There's a number of different sources.
Absolutely.
And to her credit, she really, Director McKinney really did want to work on the entire problem because you don't typically get lead just from one source. It's from multiple sources. So looking for other sources of funding, our CDBG program is one possible source for some of our housing. The housing program that Director Schrader is going to bring forward could be another source, but there are probably some private sources if you look at some other larger cities as well. And part of your grant is to be looking for some of those other funding sources and opportunities. The biggest problem tends to be windows. And the fact that you're basically rubbing the lead paint against each other and creating dust, which then the kids get on their hands and they put their hands in their mouths and create those problems. So that's a issue that would help us both exterior home curb appeal as well as safety for kids. So that's hopefully something we can look at as we move forward.
Right, and I really appreciate the opportunity to work with you and aldermen, all the aldermen around the table that have really taken on this charge. And, I'm willing to continue working on that. And I know our staff is dedicated to that also. We could go on on this one.
We've had many half-a-day conversations on this.
It is. But yeah, it's a difficult thing. I'm just impressed that our community is taking on as much as it has and really kind of moved things forward quite a ways in the last couple of years. I appreciate it. Maternal and child health, page 132. Sorry, I keep.
Immunization.
Yeah, immunization, sorry. I'm ahead of you there. Immunization, we really work hard to notify families when their children need to be up to date on vaccines, and we offer immunization clinics and track vaccination rates for infants 24 months of age and up for this particular grant. Our major accomplishment here is that 80% of Menasha children who are 24 months of age completed recommended vaccines. That's very good. We have a long way to go yet. We'll keep working on it. This year, we hosted a UW-Oshkosh registered nurse to bachelor degree prepared nurse student, and her goal was to increase vaccination rates. Now, she might have had something to do with our influenza vaccine clinic being so popular this year. We're still in the process of measuring how promotion has had an effect on our monthly vaccine clinics. Our changes this year, we have a slight increase in grant funding, and we're going to continue with notifying families, offering vaccination clinics, tracking vaccination clinics for infants and children 24 months of age and up. We have a public health nurse that works a little over 10% of her time on this particular grant program. Any questions on that one?
I just had a comment.
Sure.
You mentioned at the beginning of your presentation that 99.8% of
Yes.
school-age children are up to date on their vaccinations. So kudos to everyone, including all the families who take that seriously and get that done. That's amazing.
I certainly appreciate that. Thank you for that comment. I know Mary Fitz, our program assistant, works incredibly hard notifying families, and I do want to say that 99% does include people who have waivers, though, but that's part of the state law that allows that. So they're complying with the state law. They've made that, but what we are really happy about is the number of people who have really taken this seriously and gotten their kids immunized. There we go.
Is there a comparable out there with that number?
Pardon me?
Is there a comparable out there with that number with other school
I
districts?
can get you that.
That'd be interesting to see because that has been an issue lately on the
yeah.
national news.
Yep. No, that has been. Yep.
I think I just heard some statewide statistics too for the state of Wisconsin
I
that
could,
just came
I
out
could look
recently.
that up for you and see what that is and see how we, if we, that would be a great benchmark for us to use for ourselves, you know, to make, where are we at for the state and nation. Okay, maternal and child health. This is a grant that provides technical assistance to child care centers and work sites to improve breastfeeding policies and practices. So our major accomplishment is that we support previously designated child care sites that have become breastfeeding friendly, and I think there's 5 or 6 in the city of Menasha right now, right? 5? And you're working to get those, you know, designated. We do have 2 city businesses that we're working with to become breastfeeding friendly. One is the city of Menasha, so we're happy about that. And then we are members of the Breastfeeding Coalition and Way to the Fox Valley. The nice thing about this grant is that the regional health departments all work on this same grant, so we have a collective impact. Because it's not an easy needle to move to encourage breastfeeding practices in workplaces or in child care centers. So working together, we can improve the rates, and the rates have been shown to, you know, dramatically increase, you know, the health and well-being of our children. We had a slight increase in this grant this coming year, and we will continue to provide that technical assistance to child care centers and work sites and improve their policies and practices. Christine happens to be a certified lactation education counselor, so we are pleased that she's taken this on for us, and we appreciate the work that she's doing.
Isn't that mandatory for employers to provide a place for this?
There is a federal law that
Yes.
mandates certain businesses that have to meet some standards in order to require to have a policy in place to provide space and time for their employees.
The company I work for had built a special room and everything for this, according to federal law, so it's just, so it is a federal law.
Most businesses do have to comply with that based off certain qualifications.
Okay, dental sealants, and that is on page 134. And basically, this is the one that complements the dental program with the screening and the fluoride treatments. This year, this is all by parental consent. In 2017-18, 209 children received screenings for this program alone, and then we did 453 dental sealants on 105 children. They also received fluoride varnish applications. Our registered dental hygienist, who manages both those programs, was able to go to a Seal Smile conference and then a statewide oral health conference. The budget is similar. It's funded by a Wisconsin Seal a Smile grant, medical assistance reimbursement, and the nice thing about this one is it's completely free. There is no cost to families. We were able to work this, you asked about the school district earlier. The school district and the dental hygienist came up with a strategy to put registration in with their school registration. And it really dramatically, I think next year we're going to see a lot higher participation in this program. And, you know, the 2 programs together really do change the rate of decay. It really lowers the rate of decay. Our personnel, again, is the dental hygienist and the dental assistant. Any questions about this program?
Yeah, the fluoride in our water system, that's not enough that we have to put this varnish application?
There's, you look at risk assessments when you do fluoride treatments. So, generally you look at who might be at highest risk. And the really young children are at higher risk, and especially if any family member has had tooth decay, they can transmit that bacteria to their child. It's a transmissible bacterial infection. So it's a little complex in that you do have to do the risk assessment. And it's generally, we target children or I shouldn't say target children, but we look at children who may come from lower income families, whose families do not have dental insurance, who may not have access to dental services. However, it's open to everyone.
So the
And the tap water is, it's conjunctive, yes, the tap water and the fluoride varnish are both very effective together to prevent decay.
Okay.
They're about 18 to 30% effective in decay prevention.
But our water system alone, that's not enough? Because
You get a little systemic going through your system and topical from the water, and the fluoride varnish adds additional protection.
Director McKinney, I just have a question. Can these two budgets, the 909, the regular dental program, and this 916 be combined? Or is there some certain
They're two
grants?
different funding sources.
Is that what
So
okay.
I think that's why they were separated, but I've had that question before, and, it's something we could consider at some point. But one is United Way funded, and that is screening, fluoride varnish, and we start really early with the fluoride varnish application, the topical fluoride varnish application. We start at, early childhood. So we go to child care centers, basically. And then the Seal a Smile program is basically state GPR funds that are distributed through the Children's Health Alliance of Wisconsin. So I think they're different numbers because they might have been two different grants that came at two different times. Yeah. And again, I'm redundant, but I'm just showing you that they work together. What the fluoride varnish, if you look at it, it covers the smooth surfaces. And the sealants cover the pits and fissures, and that they're at different points in a child's life, and that's something I didn't mention. So the dental sealants are for the first molars and the second molars that erupt when children are, 6 and beyond, where the fluoride varnish, we start very, very early, and it just gives them that added protection against the bacteria, and it strengthens the enamel.
that's completely funded from grants.
Completely, 100%. And families really realize the benefit not only in the application of the fluorides and the sealants, but in preventing the tooth decay. So you really save money on averted decay, too. You're averting a problem. It's true prevention, and it's got a lot of evidence behind it. Both of those programs are evidence-based programs. Okay, 0918, we're coming at the end. Bioterrorism, and basically this assists us in developing our public health emergency plans and capacity to respond to emergencies. We are including outbreaks and incidences, radiologic events, bioterrorisms, natural disasters, chemical emergencies, and pandemics that we're preparing for. We work really closely with the fire department and police department on this particular topic. So For example, this summer, one of our major accomplishments was to work with the fire department on responding to excessive heat events, and we used that as a public health emergency preparedness exercise. We also worked with the library. I want to compliment Vicki Lenz, who is very open to keeping the library open for extended hours during the heat event. And we studied that, and we learned a lot from that, and we're in the process of revising our plans from what we learned. Again, this helps to run our annual vaccine clinic. Christine, as the Public Health Emergency Preparedness Coordinator, actually managed that clinic. So we have a lot that goes into our bioterrorism, and it works with other programs in the health department to respond to emergencies and practice and exercise. So the changes, it's very similar. We did take on additional funding throughout the year. You'll see in the budget that we actually have a little higher cost, but we also have the funds that offset those expenses. Again, our objectives will be the same: to do our event planning, to review and integrate preparedness plans. We want to this year focus on people who have disabilities and what would they do in the event of an emergency, and getting information out to them in various forms that will help them to be safe and to have contingency plans. The health department maintains a medical alert list for Menasha utilities, so we do know who may be needing assistance during a bioterrorism event, and we would like to help them prepare for those events. Our personnel on this is 0.35 FTE. We have about 5% with a backup to Christine. So Christine's time is about 30% of this grant, and about 5% is the dental hygienist that does help her. Any questions about that? Yep.
So do we know, in case of a power outage, the people that are on oxygen machines,
Yes.
is that, would someone go out, and how would there, just tell me the scenario on how we would assist them?
Yes, that we maintain that list for Menasha utilities, so in the event of a power outage, they would know, or, utilities disruption, they would know that there is someone with, and we would know there is somebody with, someone has emergency or has equipment that requires electricity and water. But we encourage those people to have contingency plans so that they can go elsewhere or maintain that equipment during that event.
Okay, so the utility or your department is not going to go out to their house and say, you got this. We're educating them, and it's on their responsibility.
Yes, it is their responsibility to have contingency plans in place.
I think. Thank you.
Yep. We were able to secure toolkits that we're going to be using in the coming year to distribute and talk with folks who do have identified needs. Anybody else? 24/7. This is like a one-line item budget. This is funded by fund balance reserve, and it is basically to cover our communications, our telephones for our staff, so that we can be in touch 24/7. And there's no personnel. And then finally, the senior center. And just want to thank Cheryl for the work that she does at the senior center and bringing in so many people in the last few years and new and innovative programs. We really appreciate her work. So the Senior Center is accredited by the National Institute of Senior Centers. The Nina Menasha YMCA operates the Senior Center under contract with the city. The Health Department oversees that contract. They offer social, educational, and recreational activities at the Senior Center. We work with the Committee on Aging. This past year, we took on strategic planning So we have reviewed the mission, vision, values, and goals. We're in the process of refining that. This past year, 2017, there were 20,084 visits to the senior center with about 8,572 people. From January to October, there were 15,042 visits by 6,922 people, so I think we're well on our way to hitting that mark in 2018. Budget changes, it's pretty similar, it's a little bit higher. Our Winnebago County grant stays the same, but it covers about 25% of the costs of the senior center. The rest is rental and tax levy. We hope to continue our contract for operations with the YMCA and maintain the Winnebago County grant and look for additional funding opportunities with the YMCA to offset our expenses. And then we are making deliberate efforts to integrate the dimensions of wellness into our program planning. So I think that's helpful to have that cooperation with the public health nurse in the 60-plus grant as well. So do you have any questions for us on this?
Yes, I do. Thank you. I have one question. I'm looking over the management portion of the budget. It comes up to $93,527. Just what goes into the management portion?
Would you like to cover that? Cheryl and staff at the YMCA prepare their budget to submit to us, and it is pretty detailed. So I'll let her cover that for you. I do have a copy of it if you need it.
handy?
I'll see if I do.
All right.
That's the contract with the YMCA. So that's
So
what we
that would
pay-
cover your instructors, all the training that we need to do for our instructors, personnel budgets, maintenance. We have to keep up with the building, inside, having somebody come in and clean the floors, somebody come vacuum, do all that kind of stuff. Equipment repairs, gas, water, electric, we pay for all that at the senior center. Cell phones, supplies, janitor, like we just had to buy a new vacuum cleaner, somebody to come in and clean the carpets, do all that kind of stuff. Retirement benefits for those employees that are full-time. There's only 2 of us that are full-time. Dues, we have to have organizational dues with I'm trying to think of the National Senior Center Association, all those kind of things.
National Institute of Senior Centers.
Yeah,
All right.
thank you.
Thank you very much.
You're welcome.
Alderman Taylor?
What was the vehicle and vehicle equipment rental, $500?
There we go. I believe that, and I pulled this out because Adam Alex does a detailed budget for us at the end of the year and anticipates what his staff needs as far as equipment at the site to maintain the building. Sometimes that's unanticipated. We don't know what's going to happen. This may be one of those costs, vehicle rental and equipment.
And you feel the heat is going up $1,500 this year? Is that what that's under?
Heat? We don't cover heat.
Oh, I'm sorry, it's under buildings.
Buildings.
I got it, thanks.
Yep,
Thank
and
you.
this again is Adam's anticipated budget for maintaining the building. One of the things that happened last year, I think with the excessive rain that we had, there was some problems with some flooding in the basement, and I know that they did deploy some people over to take care of that for the senior center. So those are the kind of unanticipated things that happened. So
We had water in the basement, and they had to bring in equipment to suck it all up and dry it all out in order to keep everything down there.
And is the building equipped with an emergency generator?
this building we have a generator. I'm not sure, I don't know that we have
I
a
don't believe so.
building generator
Okay.
at the senior center.
Because we have one over at the old city hall, maybe we should move that to the senior center. Thank you.
Does anyone else have questions for the health department?
Thank you, everybody.
Okay, seeing none, thank you for coming this evening. We do have a number of people from the Administrative Services Department here this evening, as well as the city assessor. So if there's no objections from the council, if we could move to that area first. The clerk and the city attorney had planned on being here the entire evening anyhow.
Could we take a 10-minute break? Would that
6
be-
minutes.
6? All right, thank you. I can deal with 6. Usually turns into 10, so.
Okay.
Did you give Becky your 6 minutes?
I don't know if we hit 6 minutes or not, but. Okay, we have the Administrative Services Department at the front table tonight. John, if you want to take it away.
Yeah, what I'll do first is I'll introduce the team. Obviously, all of you know who most of the team are. So we have every single division represented here tonight. This was kind of unexpected, but there's a reason why we've added another person to the team tonight. We have got Jennifer Sassman, who's representing the Finance Division. We've got Candy Huber representing Human Resources. We've got Patrick James representing the IT Guru Department. We would not be here without his help and his team. And then we've got Mark Brown, who represents Associated Appraisals Consulting Firm, who has been our assessor for a number of years. We will actually be starting with the Assessor's Department so that Mark does not have to stay here if it takes longer than a half hour. So we'll excuse him, but we'll start with him as we get through this. So these are the 4 different divisions that we've got in Administrative Services. We actually support every single department, every single building, every single employee, to some degree, be it valuation, be it tax collection, be it collection of revenues, if it's cash management, if it's debt management, if it's payroll, if it's hiring, if it's fringe benefit administration. The whole team here at the table does all of these services for all the other departments. The city assessor, finance, and human resources are funded by the general fund. However, for a long time, a number of years, the information services division has been funded by internal service, and that actually gets charged across as just similar to like the street fleet replacement fund, that this is funded through all departments and all funds. So it's not just the general fund that's paying for it, but all funds, be it if it's the stormwater, sewer utility, and other funds, everybody does contribute towards the information services area. So if you want to turn to page 3334 first, the city assessor department, what it's made up of two different parts do the work actually for the assessment valuation each year for the city. You have got the portion that's done, that's non-manufacturing property, so it's residential, commercial, swamp, any agricultural, forest, all gets done by Mark's firm. And there's a firm contract annual amount of $60,000. Along with that, we do have actually half-a-day services on Tuesdays and Thursdays that somebody from Mark's office is here in an office that can answer any questions for any of the departments. If any of us, or community development, or finance, or other departments, or public works have questions, or if any citizens have, it's time that anybody can come and ask a question of the assessor's office or relay a question to Mark's office, and then we can get an answer back. The other portion of it is the state of Wisconsin does do work for all of the manufacturing properties. That's been in place for a number of years, and that's roughly about $5,000. So that portion of it gets added to Mark's numbers for his firm, and then it's combined to come up their total assessed valuation each year. And then there's a balance in the budget for IT costs, postage, printing. So that makes up the whole component of the assessor's budget. But the reason we have Mark here tonight is I think I'm going to jump ahead to this slide here. It can probably be easier to see it on the paper copy that was handed out to you. That we have in the last 3 years, it's been very noticeable. If you focus like on the far left-hand column, the residential column, might be easier to see that if you look, the top half is 100% full valuation. Those are numbers that come to us from the state. So the equalized valuation, you can kind of see for 2014, the residential full value that came from the state was about $705 million. And then if you jump down to the bottom half, where the assessment valuations are determined each year, you can see that the number was $709 million. So it was very, very close. What has happened in the last 3 years, from 2016, 2017, 2018? There's been a large gap, a large difference. The difference between what the state has said, looked at market valuations, looked at sales data that has occurred, and determined that the valuation increase across a number of classes of the property, including residential and commercial, had been accelerating at a faster pace than what our assessed valuation is. And as you know, with our assessed valuation, typically we've gone through 1/4 of the city every year and done a redetermination for a valuation change. It could be up or down on determining on some of the market factors out there and based on sales that have occurred in parts of the city. So you can kind of see that the gap is growing. If you go to the far right-hand column, it's very noticeable that in 2016, on the equalized valuation increase, the state increase across all classes of property, over 4%, 4.05% increase. Last year, 2017, increased by 6.28%. And for 2018, it was a 5.42% increase. That's what the state did. Now remember, back around 2009, 2011, there was devaluations that they had done when we were going through the economic recession, that all properties and sales data and everything was triggering it that much, much lower, that every property value should be valued lower. Now this is adjustments based on sales data, and we believe that for the next year, for 2019, we probably will not be a 1% increase. It'll probably be something, may not be 4 or 5 or 6%, but it's going to be.
It could be closer to the typical norm, what we've seen, maybe 3-4%, somewhere in there. It just depends on the remainder.
John,
of the
if you
year.
guys want to share a mic,
Yeah, well,
otherwise no one's going to be able to hear Mark.
Just heard for this part of it. Oh, we'll get to that.
You can add anything that you would like in the budget.
We'll get to that
Alderman
tonight.
Taylor. Just make a motion.
So you can kind of see, now if you look in the lower right-hand corner on the assessment side of things, when we've done the revaluation 1/4 of the city, you can kind of see the last 3 years. Now, remember 2018, it was practically a no change in valuation, but remember roughly about $6 million of non-manufacturing personal property for manufacturing tools and patterns came off the valuation. That's not just Menasha, that's statewide. So that was something that changed with the state budget. So they went ahead and did that. Now, in place of that lost $6 million of valuation, what they did is they will be giving us in every other municipality a state aid payment, a new aid payment, which will be $68,000 in next year's budget. We do have that put in there already. So taking the $6 million out, in trade, giving us $68,000 in exchange for that. But what happens now going forward, new businesses coming in going forward maybe would have reported a number there. We'll never be able to report that. The businesses don't have to report that number. We'll never get any amount of additional money or taxes collected for that. So the state aid payment will be tied to not a cost of living factor, but they'll put an inflation factor on that number. So that $68,000 will go up very slowly. But if we would end up with new businesses that would have triggered the new valuation, it's lost. It's forever gone. But that's the decision that was made by the state. Now, this does not impact any other personal property at this time. You probably have heard over the last couple of years, all personal property maybe in the future could be lost, be gone. And that would, be a detriment to all communities. How will you come up with that? I cannot ever envision that the state would ever come up with state aid for all personal property that's gone. They did it for this little sliver going forward that they've locked in now for us. But going forward, if they end up getting rid of manufacturing personal property or other types of personal property, that they may not give us that additional aid in place of that. So that's just kind of a heads up. But the reason we have Mark here tonight is because you can kind of see this growing difference in valuation that has changed. And when you then flip to the page prior to that, the mayor has talked with me about kind of doing the comparison of tax rates and kind of setting the stage for tonight for this discussion. So what we've got laid out here are, we have the city of Menasha. The upper portion is the equalized if the valuation was 100% full value of what the state says every single year. And then you've got city of Neenah, city of Appleton if you're in Winnebago County, or in Outagamie County, and then village of Fox Crossing. The one caveat I want to make mention talking with Fox Crossing today is just remember, even though their tax rate, local rate is much lower than everybody else, they do not have library on their village tax rate. They get it charged as an additional charge through the county tax rate. So we don't have that on the county portion of the rate. They have it on theirs. They also have they get health services. They get charged that also as an add-on on the county's rate. Ours is embedded in our city rate. Theirs would actually show up as an add-on to their county rate. And then they also have a portion for planning and zoning that they told me today, that they said that'll eventually go away, but right now the county does contribute to helping them with county and zoning work that they've got. So they have 3 extra items that get added on their county tax rate. I don't know what that adds up to. That's something I could probably look into at a further time. But just letting you know that it's not a true comparison for full services all on the local rate. There are some things that Fox Crossing has on the county share part of it.
And they also have a garbage collection fee, which would probably amount to about $1 on our tax rate if we separated that out.
So we could at some point combine all of that together to make it more true comparison. But the reason we're showing this is that if you obviously can see that if we are at full 100% valuation, the years of budget year 2010 through 2013, it was relatively at a stable level in the 819 to 886 range. When you compare us to Neenah, Appleton, we were very comparable at that time. And maybe even in some instances, might have been even a little bit lower, like for, say, the city of Neenah. Then the steam plant obviously took effect with the 2014 budget. So that added not quite $2, but it added at least $1.50 onto the rate. And then you can kind of see since that time, if we would have been at 100% full valuation going forward in time, the rate would have fallen because the community was growing. You could see that where we're proposed now, the equalized full rate would be at $9.84. And you can kind of see where that is in comparison to Neenah and Appleton. If you would take the $1.30 off of what we're paying right now for steam plant debt, we would actually be below them, both of them. Now, when you go down to the assessed tax rate, which is the bottom portion, that's the reason we've got Mark here tonight, is that you can see what the rate is doing because that valuation for 100% full value, the difference is growing. We're over a 10% difference right now between the two. So you can kind of see between 2014, 2019, as the equalized rate was falling, the assessed rate, because the assessed valuation wasn't keeping up, kept increasing from like 2016, 2017, now through 2019. The concern here is that we would at some point go over $11, and then how would that set us up for marketability talk when you compare our community with our other neighbors when the mayor and Sam, Director Schrader, are talking about bringing additional businesses, bringing economic development here. That might be a difficult question to get past because we'd have to focus on, we'll look at our equalized rate, but our assessed rate, what actually shows up on the bill, is something much higher than that. So this kind of leads us to the discussion then is, when is the right time And one other thing, that on the next page here, where you see the big preliminary on the, this is the annual report we get from the state, and this is still preliminary, that they look at when should a reassessment be triggered, and once a class of property falls below the 90% threshold, which this is, we've got the years from 2013 through 2018, you can kind of see, you look all the way back to 2013, 14, 15, the line that says residential in that racial column, you can kind of see we're at 102, 101, 100%. We were doing very well there. However, now in 2016, we were at a little over 96%, then it dropped to 93.69%, and then it dropped to 88.68%, which means that the difference between what the state says full market value should be for properties versus what the assessment roll is showing. And even knowing that we're doing and reanalyzing 1/4 of the city, we'll never catch up at that rate. So the question then to you that we would like to discuss with you tonight then is, when is the right year to look at doing the entire city? And Mark, I'll let Mark talk about it, about recalibrating the model, the formula, and what year would be the right year to maybe look at this.
So, this last couple of years, obviously the market has changed quite drastically since we saw the decreases. And so what we're seeing is the Department of Revenue are becoming more aggressive with their economic adjustment to their equalized value. Just for example, this last year, they increased their equalized value by almost 7% just on the residential class. So just in 1 year, we dropped 7% difference between the two. And so what we're kind of proposing is that for either 2019 assessment year or the 2020 year, we look at more of a comprehensive across the city changes in assessment to bring everything back in line again to market value. We had brought that up the last time we kind of talked about the newest contract and had an addendum on there that showed 2020 or 21. But with this latest, numbers and changes, we've said, no, we should probably look at doing this for 19 and 20.
Sooner.
Do it sooner rather than later, just to get everything across the board back in line the same year.
So the proposal from Mark's firm is that they would end up looking in doing, it would not be full walkthrough every single parcel in the 2 counties. It would be done in the office, looking at data, running analysis, running and updating the model.
So currently, right now, we're visiting 25% of the city's parcels over a 4-year cycle, so that we're not doing interior inspections, full inspections 1 year. We're spreading that over 4 years. So in this appendix, in this change, what we're saying is, well, instead of doing that 25%, we're instead going to focus on updating the model, recalibrating it to current conditions, current cost information, all of that for 1 year, getting it back up, and then we'll just start up with that 25% the next year. Currently, to date, we've already inspected about 12% of that 25, just given the timing of the year and things like that. And so for this next year in 19, we would just postpone that until after this next cycle, probably sometime in August, September, we'd start that back up again until the next year, which is 2020 assessment year. So,
Question, Mark, then, would your contract services for that year still be $60,000?
yes, and that was the reason we did it this way. If you notice down the bottom of that, there's no additional fees as part of this. It's just really changing the scope of work of the contract year, or the work that we're doing. We're kind of, instead of doing the field inspections for a portion, we're just focusing more on doing the valuation side. Instead of doing parts of the city, we're doing the whole city. And so it's really just changing the scope of work for that 1 year out of the length of the agreement. So.
And remember, in a reassessment year, now what would happen is that if the valuation were brought up roughly about 12% to bring it up to full 100% market valuation, between maybe 12, 13% to get it up to 100% full market valuation, there is the potential that everybody's valuation can go up. However, you will have an average, so that even though your property value might go up a little bit, if it's less than the average, there is a chance that if the city's levy and the tax rate don't change much on that they might actually see a reduction in the city portion of their tax bill. So if the average home value is 120,000, and if that would maybe go up to, say, 125, 130, if that's the average. Those that go up from maybe 100 to 110, it's an increase. That does not necessarily mean that very likely their bill, their city's portion of the bill could go down. Those whose average would go up more, larger than the average would then see, those would be the ones that would see the increase. But what would happen is that the rate would reset. So the rate would fall, and like the mayor and I talked about this today, we put a line in there for the goal. I don't know what else you want to call it, because right now the proposed rate right now for assessed is looking at 1094. But our goal would be to try to get it where the equalized rate is, which is at the 984 level or lower, because you can see the last number of years, the last 4 years, that equalized rate has been falling because the valuation has been accelerating, and that 984 actually could be maybe 970 or something lower than that. So right now, all we just thought is, just for showing a very easy example, and the city of Neenah is also going through the same thing. They've already decided that they are going to do a full revaluation or recalibration of their model and their numbers next year. So what will happen with their rate, their assessed rate now that they're proposing on adopting in a couple weeks is 963. But if they go ahead and remodel all their valuation, their rate could possibly drop to about 867. So question is, what does the city of Menasha want to do? When would be the right timing to do this? Because you can see if we stay on this track, our assessment rate will be likely tracking over 11 or higher if we don't ever get caught up to what the full market value is.
I think everyone looks at,
Go ahead, Stan.
I think everyone looks at that equalized tax rate, you know, and that's probably why I worked so hard last year trying to get that down, that levy number, and of course this is another way of doing it. I would think sooner than later. So I would agree that we should do this. And then also, kind of caveat to this is, back to the fire department issue with square footage. How do we work with his staff or his group in determining that to help us with that future number? Because when we were talking about one community has it and the other one doesn't, well, we're the ones that doesn't. No one using Neenah or Menasha, but it's Menasha that can't provide that.
And I don't know the reason, I didn't even talk with Mark on that just yet.
Okay, never mind, then that's for another day.
Yeah, but that's something I'd like to know, why was it dropped? Why can't we quantify it? Because in Market Drive, we can store all this data out there, so how could we? I don't know, but if it's something that actually during this whole recalibration process, we could actually talk about that and see what would it take if that data is not in that one field, what would it take to get it in that field?
I think we had issues with getting the data for the manufacturing properties that were assessed by the state, was where that was missing. And we ran those numbers with and without that data for the fire department formula, and it really didn't change the payments, and that's why it was decided that we could drop that. But Alderman Nichols?
Thank you, Mayor. Could you just help me better understand how this happens? I understand that the DOR is moving aggressively on their adjustments. How is it that the assessor's evaluation doesn't necessarily track with that? I just don't understand how that happens, so can you help me out there?
So for every property in the city, we have a system, a computer-assisted mass appraisal software system that allows us to analyze and update assessments in mass. So every property, and essentially, the Department of Revenue is looking at a macro level, what the cities compared to other cities and stuff in the community. Our job as the assessor is individual properties, and so, as part of this, there's a base model in place that is using data from 2001 essentially, that needs to be re-updated to current, cost values based on the last couple of years. We've seen a shift in the market for new construction has cost so much more today than it did even 2 or 3 years ago. You have different market preferences that have changed. We look at depreciation of homes, so as they get older, they're in different, disrepair or whatnot condition of the homes. Those different variables needs to be redone. It needs to be completely re-looked at and reanalyzed again based on today's market as opposed to when the last time it was really redone at that point, which for the city, most of that main body of work was done about 2006. And then since then, we've been doing more like factoring adjustments to that model, that base model. Now we're getting to the point in order to capture all the changes that are being, made by buyers and sellers right now in the market. We need to do a comprehensive kind of a rewrite or a reanalysis of our model to match those sales so that going forward we have more flexibility to make these adjustments across the board than just specific neighborhoods or different things like that. So it's just a more comprehensive change of our model or system that we're utilizing today.
So based on what you've just said, you're basically using an algorithm or a formula, so to speak, and plugging in information, and I'm sure the state's doing the same thing at their level, just using a different model.
Essentially, sure.
Taking bits of information and plugging them in to come up with a number, so to speak. That helps me understand it better. Thank you for that explanation. And you mentioned that it was last recalibrated in 2006?
Last
for Menasha.
Yeah, like it's from ground up recalibration, yes.
And that's the formula you were using, not a full reevaluation of the city in 2006?
So the last full, every parcel in the city completely reassessed at the same year was 2006.
Okay.
Yeah.
So 12 years ago.
Now, since that time, we've been making, updates to assessments. We've been changing values up or down based on how the market has been. But not recalibrating and starting from scratch on that model, where now we're at the point where that needs to get done.
So I'm wondering if there's a way that in the future that reformulation could be done on a more periodic level, on a more periodic basis, instead of every 10 or 12 years. Do we need to look at this every 5 years and make sure that we're tracking data appropriately?
Give you an example. So as assessors, we follow the Wisconsin Property Assessment Manual. And in that manual, they publish a cost manual for kind of a foundational for the cost approach. The last time they published that was 2001. So that's our foundational manual we're using for costs. And then every year there's a modifier applied to those rates, which give us those replacement cost estimates. The last time that was rewritten was 2001. They just released the new one, 2018.
And that comes from the state?
That comes from the state. So this also coincides with that, hey, we also have a new manual that we can update and put into place with part of this, and not factoring a 2001 cost kind of basis, which was the foundation used in 2006 and has been used every year since then. Now it's a chance for us to kind of start over again and recalibrate everything based on more current information. And that's kind of the purpose of talking about this months ago, even before the equalized values come out and all the changes. We kind of knew this was coming. We were just thinking maybe 2020 would be the earliest, but now we're looking at probably next year is much better for the city. So.
And thank you for mentioning that manual, because I knew there was a specific procedure that you followed regarding assessing properties. And so to think that that hasn't been updated since 2001 from the state of Wisconsin.
Part of the manual.
There's obviously a lot of things at play
Right.
here in this process. Thank you.
Now, with the timing of this, obviously, we've typically have had board review usually in June, or in May, end of
April, May timeframe, generally, yeah.
Like, what this would do is if we were to do this in whichever year we do this, this would then extend that to an August, September period. So it's roughly adding 3 months onto the timing. Now, we still would have estimate numbers that we report in by the second Monday in June that we're required to, especially like for the TIF valuations and things. However, those could be estimates and then they could be finalized later on, I believe.
Correct. State requires
So-
we provide them with an estimate report if the roll is not finalized, and then once the roll is finalized, we then update those for the final numbers, so. And that can be done anytime after board review.
So open book would typically probably take place as we kind of estimated maybe like an end of August. And then they'd have the board review sometime probably in September to do this.
John and Mark, would one of you want to explain why we have both an equalized and assessed value and why it's important that we have both? I mean, we need to collect $10 million at the end of the day, and why not just use assessed and not even have equalized? And I mean, this whole concept is something that makes my head spin, so I'm sure that the aldermen's heads are spinning worse than mine.
If you think of it this way, Department of Revenue has an equalized value. It's always to be at 100%. And they do this for apportionment purposes, so that each municipality is viewed equally for apportioning the different levies for school districts and, county budgets and everything else. In terms of assessments, those can be at different percentages of those. And really, the assessment doesn't affect total taxes collected. It really just distributes the tax burden fairly amongst property owners based on what their property is worth. That's why we do have a dual system. You'll see it on your tax bills. It'll say the assessment, then your estimated fair market value. The estimated fair market is just divided by the aggregate ratio of the community, and that changes every year.
Right, so what happens is the state is not assigning an equalized value to every individual parcel in the city. It just says, okay, total residential class, or total grand total is blank. And then when we run the tax bills, it kind of divides it up and just allocates a portion of it. But they don't even assign it by class of property, if I don't remember right. It's just grand total, that's it. So
equalized value basically equals your fair market value, what you could sell your property for.
in theory, that's
In
what
theory,
when they
yes.
run their models, yes.
And assessed is a ratio of that. I don't know who was next. I think Alderman Taylor was.
How can we better be informed on these state formulas that are changing, especially in manufacturing?
So every August is when equalized value gets published by the state, it's required. So August 1st, they come out with preliminary, and then August 15th is the statutory release date. And then shortly after that, then these major class comparisons, typically October every year is when they come out. So this is when the major class comparison reports come out, you know what percentage you're coming in at. They use that to equate their manufacturing roles, all that sort of thing. So every year about this time frame is when these reports are available.
Okay, so when the state legislature changes this must be published ahead of time that they're going to be making these changes. So I'm thinking, for municipalities, for councils to maybe object to something that they're going to be voting on, when is that would come up for cities to be aware of that?
I mean, the full 100% valuation comes out in August, and that information I shared with you at that time. But now they don't finish their job. Like Mark said, this report just comes out finally in October. We just got these information like in the last couple of weeks. So now we know what our assessment ratio is, and it's like, oh my gosh, now we've fallen. And what's interesting when you look at the counties, Calumet County was just kind of revalued. That with Mark's firm had just done that last year, but that has already fallen like like about 10% already down below where it was a year ago. So it's just, what the state's doing with their numbers it's based on sales-driven data. You've got a market out there that people are just selling, and at a much higher valuation than maybe they had bought the home a couple years ago.
But these changes that they keep throwing at us, some years back, they took the computer tax off. And when they keep making these changes and what's coming our way or what's not coming our way, are those made throughout the year, or is that made at
You kind of know when those are coming up in the 2-year budget cycle, because like right now, the next state budget they'll start right now they're probably working on the process because there's going to be a state budget that will be released by the governor in February of 2019. Technically, they're supposed to adopt the budget by June 30th of 2019, but with a new governor and with the legislature that's in the opposite party, who knows if they'll have that done and agreeing to anything by June 30th. That could get dragged into late fall, for all we know. But all the changes that they put in the budget for doing these little tweaks would be in that 2-year budget. So we would know already by January or February of the additional new rounds of changes that they're going to be proposing by the Department of Revenue for doing some other tweaks or something new, like personal property. We all got to worry that one might come in this next year budget cycle. All they did is they took a little sliver off, but you can rest assured they're going to be making more tweaks and more tweaks. And are they going to keep giving you additional money in replacement of that, or is another taxing jurisdiction, the university system, counties, municipalities, school districts, technical colleges, who's going to be the winners and who's going to be the losers going forward? It's hard to predict that right now.
So the best place to find out about those things, Alderman Taylor, is you should be getting a update from the League of Municipalities emailed, and all those types of legislative changes typically are in those emails, and they tend to occur, like John said, at budget time typically. And that's when you'll see the most of them.
It'd be nice to get out ahead of them when they're proposed.
Exactly.
Yeah.
And that's when you'd find out, but I'm not sure if you guys all got this one or not. I just got this evening, and the league's, what is it called? It's their league lobby team, and they're holding a webinar for municipalities next Tuesday. And it's to talk about strategy and how we anticipate things will change in the 1920 legislative session. And it's at Tuesday at 1 o'clock, and I'll be watching that here if anyone wants to join me. I'm assuming you could watch it at home as well. If you're interested and didn't get that email, let me know and I can forward that to you as well.
Thanks. And also, in the Post-Crescent, we kind of always get beat up when they show the values. And, we don't charge for streets, and we don't charge for sidewalks. And so I think other communities, if that's a new street in front of your house, you're going to be paying some pretty large sum of money. So I think somehow we need to communicate that better on our tax rates.
I mean, we can take the model for the combined rate or the local rate here. Oh, wrong way. Thank you, Patrick. We can go ahead and take the rate here and equate that to say, $100,000 home, and then just say, okay, what additional fees would they be having in addition to the tax levy portion? If it's stormwater, if it's garbage, if it's refuse, if it's something else, we could probably, or even maybe try to come up with a way to equate a special assessments or something, that ours is included in. If you had, maybe I can work with Josh, we can try to come up with something. So that you can make this more comparable. But our concern right now is looking at the last 3 years, the valuation difference that just keeps growing. There's no way with the way we're doing things will ever get caught up. And my concern, as long I think with the mayor, is that with the rate where the assessed rate is going, how will we ever be able to be in the market and economic development wise to bring that next business, that next manufacturing, that next whatever here anywhere in the city, if they look at assessed rates, that's not going to be a good thing. If we look at the equalized rate or get us close more to 100% full value, then we're much in the ballpark.
So it sounds like 2019 should be our year.
I mean, this doesn't affect budget because the budget amount is the same, which we appreciate that offer from Mark with that addendum thing. We didn't bring, I don't think we had signed any, but this is with the new dates on there. I would bring this to a future council meeting to do this. It doesn't affect budget, but we thought we'd bring Mark in because the timing to do this is your direction. We're bringing you, it's a policy change from what we've done. We typically have done our 1/4, 1/4. All of a sudden, we're going to jump ship on that and do something different to try to get this here as corrected and more equitable as it should be.
I guess the other thing I'd like to say a little bit is the Post-Crescent has a formula when they do these news stories about budgets. And I've tried to convince them for at least 2 or 3 years now, probably longer, that we should be comparing equalized rates, because that's really what equalized rates are for, is to compare community to community. They only print assessed rates. So that skews these numbers all over the place. Then we try to tell them about what's included in our taxes compared to the other communities, and that's too complex for them, so they don't want to talk about that. They have a little chart, they plug the numbers in, and they hit print. And if we can have something that mirrors what everyone else does, that will help us within these simplistic news stories. So that was the other reason why I wanted to bring this to your attention. We'd have to put this on an agenda to do this, but we thought as part of what's going on in the assessor's budget that it was a good night to talk about how this affects us, how it all works, and all that good stuff. So.
And I would hope from your administration that we could get, stay ahead of this game, and, if we need to, if there's something proposed in that state budget that could really affect us, we put together some sort of a resolution or something, asking them not to do that.
The league actually did lobby very heavily against the removal of the personal property tax. It is, usually these things are cut and dry and decided before that even gets out to the public. I would argue that the study group that I'm on for the state trust fund is pretty much cut and dry and decided before that group was ever even put together. We've had a little bit of success, but not much. A lot of these things are done in closed door before they even come out to see us, but we keep an eye on those things, as does the league.
It's nice to call our senator or our legislature up to. Thanks.
And Randy, were you next?
Yes, I was. Thank you, Mayor. John or Mark, out in District 8, I think John alluded to that the people out there, their assessment was raised last year. The houses out there. And so they were not very happy when I walked around and talked to them. And so now we're going to raise their evaluation up again. Am I understanding that correctly, or how will it affect them? That would be better. How would it affect them? These are all, and the area, probably all $200,000 houses and above. How will it affect them?
I mean, at the end of the day, the assessors, we're reflecting market value in the assessments. And so, if the sales are showing the assessments are lower than market value, then there would be an increase in the assessment. If their assessment is still in line with what it's worth, then there wouldn't be a change. I was telling John earlier, typically on a full citywide revaluation such as this, you're going to see 33% of the properties go up, 33 will go down, 33 stay the same. And it's really a redistribution of that tax burden based on what your property is worth today as opposed to what it was worth last year or 2 years before. And so some people that saw an increase last year, maybe they won't see as much of an increase as other people, but they probably will still see an increase because the market has appreciated since even last year, 3-4% in most cases. So,
okay, so how would it affect I'll use a $50,000 house in another location in the city of Menasha. How would it affect that house?
Just, obviously there's tax implications for assessment changes, but when you see, John alluded, average increase is a certain percentage. Let's say average increase in the city was 10%. If those portion of the city only sees a 5% increase this next year, then their tax burden theoretically should not go up. It should stay about the same or possibly even go down. Because as I said earlier, the assessments don't affect the total taxes collected. They merely just distribute it. So if you have, you know, an increase in the assessments, you're distributing your tax levy over a larger portion. And so therefore, the tax rate should drop down closer to what the equalized tax rate shows. Because right now your tax rate's artificially higher because your assessments are lower than what the state is carrying on 100%. And so what, you know, I don't know exactly what changes will happen in those price points or in that side, you know, just off the top, but
It's all probably driven on the sales that have
Based on
occurred
the sales.
out in Calumet County, whatever house sales have happened in the last year or two.
whatever properties have been more affected from the current market conditions today, they're gonna see a change in their assessment more than somewhere else in the city that hasn't been affected as much.
So, okay, so maybe a lower valued house might not see that grade of tax increase because just,
Let me try this, Mark. An
okay,
average house is 120,000 right now in the city of Menasha. Our average increase, let's say the average increase was 10%. And that house went up 10%, what's 10%? So that's $1,200.
1,200.
Yeah, so that house is now, the average house is now $121,000.
No,
132,000, yes.
132.
So if your house went up the same as the average, and your bill was $5,000 this year, next year it would still be $5,000 because we're not collecting any more taxes. We're just increasing the value to the market rate, but we're decreasing the rate of your tax rate
Okay,
lower, so then it adds up to the same number. But
So
if
we-
your house value went up faster than the average, then you would pay more. If it went up, if it actually decreased or went up less than the average, then you would pay less.
okay.
But the goal is to collect the same $10 million, but just apportion it differently throughout the city. We're not collecting any more money. But as Mark said, it depends on which neighborhood is appreciating faster or slower or average.
Okay.
So there's gonna be winners and losers throughout the city.
And as my district being the newest district, we'll see if we're the winners. We'll stay the same. Okay.
Or because it was
last year.
just redone last year, it might not appreciate as much. I don't know
Might
what
not
to tell
see
you.
as great a change as other areas that have
That
showed
haven't
a
been
faster
touched for
slope.
3 or 4 years, yeah.
Okay, all right, thank you very much.
But we would not be collecting any more money. It would just be distributed among the houses differently.
Okay.
Alderman Nichols?
Thank you. And I think at the end of the day, a homeowner's biggest investment is their home, and they would very much appreciate having, a better understanding of the true value of their home, especially in a seller's market. My question is for Director Jacobs. Would any of this have any implications to future levy limits or anything like that?
No, because the same dollar amount that we're collecting for tax levy, I mean, just by changing the rate, changing the valuation, we're still collecting, like the mayor said, we're still collecting the same dollar amount. So irregardless if we do this or don't do this, that levy limit law does not come into play with the reassessment, with the rates or valuations going up or going up a lot or going up a little bit. That won't have any play in that.
Thank you.
Now, the TIF districts are, the amount that's collected for accounting purposes is based on the equalized rate. So irregardless if we do this or don't do this, the amount that the TIF districts are collecting are totally unaffected. So the TIFs are not getting screwed over because the assessed valuations are too low. It's based on the equalized valuation and the equalized tax rate. So the TIF districts are not losing out. So if you think that our TIFs are suffering because of this, that is not a true statement. The TIF districts are based on equalized valuation and equalized tax rate. So if we do this or don't do this now or years down the road, the TIFs are not losing out on that.
Thank you for pointing that out.
Okay.
I do think it's important that we move ahead with this sooner than later.
Alderman Kruger?
Thank you, Mayor. I agree. I think this is something that we need to do this next year instead of putting it off until 2020. My only question is as you can see, I mean, there's a little bit confusion among some of us up here on how this exactly works. That a homeowner, when they get reassessed right away, they just automatically think the city's just punching them in the breadbasket to get more money. Can this be simplified and explained prior through a letter or something stating this is just a resetting the evaluation, the equalized tax rate, and and the goal is to lower the tax, the overall assessed tax rate? And is that something that will be put out in advance of going forward before the assessments are done?
I think we could probably do that. I've been in this situation before in a previous community, so I've done this before. So we can go ahead and indicate maybe in the letter saying, I mean, we can, if Mark's numbers get close to final, we can kind of say, okay, the average increase homeowner is going up, say, 12% or 10% or whatever that amount is. We can kind of keep this very simplistic and say, okay, if your home is going up from 0 to 10%, there could be a very little change, if anything, or even a slight reduction in the amount you pay for city. Now, this doesn't have anything to do with the school district or other taxing jurisdictions. We're just talking the city. And we could say maybe between a 8% and a 12% increase, you're practically going to probably see a no change or a relatively very minor change in the tax bill. But if you go up more than, say, 12% or 15%, there likely will be a slight increase in your tax bill. Yes, so we could keep it very simplistic, put out a message that way. It's just we would need to know kind of what that average increase would be, and then we can kind of create a letter, and we can even maybe share that with you first before we maybe send that out. If you'd want to see that in advance, so that if you hear this, if there's this discussion in the newspaper about it, you'd be able to answer your constituents and just, let them know and be fully honest with it, why we're doing it, and what that, just because your valuation goes up anything does not necessarily mean you're going to have your larger portion of the city tax bill will go up.
Correct.
Yeah.
Thank you.
Sounds like a booklet, not a letter.
I get wordy, I'm sorry. So
We've been about an hour on this already, so. Alderman Seveneth?
So then I'll conclude, right?
Sure.
So part of the problem here is that, did you say we fell below that state 10%? Or were we close?
Yes.
This will be the
Okay,
first.
This is the first. Now,
that's-
Mark can explain if we do nothing, how much time we have.
So the state allows municipalities, once you fall, you get 4 years. So
Right.
if you're out for 4 years, they'll send a letter saying, you've been out for 4 years, you need to bring it back in line. And then if you don't, then there's some pretty significant ramifications.
So just for the council, part of the understanding of doing these evaluations, a quarter here, a quarter there, was try to catch up. Try to have that equalized rate. I think everyone here agrees that we need to do this, so that we, number one, follow state statute or law, whatever one that is. But Steve hit it on the head too. People, I remember in the past when we had a reassessment, people would say, "Oh, if you think my house is worth $100,000, you can write me a check right now." But what they don't understand is what we're doing in this to everybody, so that things equalize out, so that you're paying actually a fair share of the taxes instead of one group paying more than the other by doing what we were doing. We were doing that just to kind of keep things in line, and it's expensive. But I think by doing it this way, we have new technologies, we have new ways of doing things. We don't have to walk outside with, years ago, they had the big stick. You remember that? Any of you guys remember that? Measuring the outsides of the buildings and stuff. You don't remember that?
You're old.
You're older than me.
Use those and lasers today.
Yeah, now you got lasers, so I mean, it's just, but, so our constituents have to understand that this is actually, in many ways, benefiting them. And I agree that when we go out, I've been arguing this for a long time, that number represents the city, and we've always gotten a bad rap for all the wrong reasons. So I think this will take care of that.
You have on the chart there that the residential class is the only one that falls out of compliance right now. It's below 90. But we're looking at doing commercial, doing all of them, bringing them all up, not just the residential, which falls out of compliance right now. So.
Do you have the sheet that shows, oh, right there, is that the one that shows when we were at 100% just not too long ago?
Yeah.
So, I mean, this really isn't
This is a phenomenon in 3
long-term
years. This has been
issue,
the
yes.
last 3 years, and the increases have been huge coming from the state. I don't know if it's a correction that they've done when they did the devaluation back in the recession years between 2009, 2011, 2012, if this is just, or if it's just the market. Like Alderman Nichols said, this is a seller's market. People can get a lot more than they could, say, 2-3 years ago on your home today than you could back a couple years ago. So
we'll bring something forward on the next council agenda just to formalize this. But I think we got a good flavor that we'd like to move forward and do it the same year as Nina, so that everything is kind of reset the same way, and we'll have a little bit more discussion probably at the next council meeting then as well. Any other questions for Mark before he leaves? Thanks, Mark.
Thank you.
And John, if you want to, oh, you have a nice PowerPoint. We should just turn the page, I bet, huh?
yeah, we're gonna
There you go.
fly quick. Candy said keep it short. Well, I'm sorry, but the rest of this can go pretty quick.
I think you're shorter than the health department regardless, so.
Okay, we'll fly through the rest of this because I know Attorney Captain is anxious to talk tonight, so. And maybe, and Clerk Galeazzi probably has something to tell us about last night, so. On the Finance Department for Comptroller Treasurer, you've got pages 26 through 28. There are no staffing changes. We actually have 4 full-time employees there. There are no major cost increases there, and we did decrease our office furnishings by $2,000. In the Human Resources, the next section, pages 29 through 32, we have 2 full-time employees in that division. There are no major cost increases there. There again, we have legal services looked at that. We've decreased that budget by $1,500. And the management contracted services area, we decreased that line item by $2,000. So we did do a little bit of cutting in our own budget comparing 2018, looked at the actual year-to-date activity for 18, and then proposed our budget for 2019. Next pages 35 and 36, tax refunds on collectible debt. Jen would be able to probably answer any more questions on this better than I could, since she's got the historical perspective for her tenure here. The tax refunds, we are increasing that, or recommending to increase that $3,000, I believe from $3,000 up to $6,000 for budget, which is closer to actual that we are having to incur. And then the uncollectible debt, we're looking at reducing that one down by $500. So we've made just a couple little tweaks there based on actual activity that's been occurring in 2017 and also in 2018. Patrick, is my finger just not working on it? Okay. Miscellaneous other budget, page 170. This was something new that we did for 2018, for those of you that were here on the council last year. We were notified totally notified me when I first got here by the library. The library indicated that, oh, guess what? You've got a 27 pay period to be worrying about when we get to the 2020 budget. And my 2 predecessors in my position didn't want to deal with it. And when I talked to the auditors about it, they said nobody wanted to deal with it then either. This happens every roughly 11 years, depending on how many leap days you've got in there. But about since we get paid every 14 days, roughly every 11 years, you have a 27 pay period that falls, and it just happens to end up on the last day of calendar year 2020. So and so you either give everybody a pay reduction, or you actually go ahead and pay everybody, and with the hourly people, there'd be no way to do this differently. So what we've been doing in when we close out the 2017 year-end audit, we went ahead and put money aside in reserve to carry forward to help pay for the 2020, the extra pay period in there. Then for 2018 budget, we propose on putting an additional $35,000 from the city's portion for the general fund. The library, I believe, put in about $7,000 in there. So we just keep rolling that money and keep accumulating it, so that when we get to the 2020 budget, that we will not have to fund another $300,000, which we won't have, or don't want to have to raise the tax rate to do that. So what we did is 18's budget, we put $35,000 in this area for this one line item. And then for 2019, we went ahead and just added the one extra day. So across all departments, all funds, we've added the one extra day there. So it's built in, so we didn't have to have a separate line item just for 35 or whatever here. So we've allocated already. And then if you remember, one of the adjustments that was done by the council a year ago was we added $20,000 in for the HRA fees for the retirees, because at the time we proposed switching it, the council felt there was not quite enough notice given to the retirees on this, so the city decided to go in and afford to pay the additional fees. The actual amount is only needing about $16,000, so the other $4,000 we transferred to pay for the closed captioning. So if you remember that budget adjustment earlier this year, we went ahead and took $4,000 out of the 20, so we have 16 that was left here for a budget for 18. We're not looking at redoing this. We're just assuming, based on the discussion last year at budget time, that we would not do this going forward. That was a one-time, one-year option that the city would do for them. But going forward, the retirees that were on notice, they'd have to be paying this going forward. And then for 2019, we had put in a 12% increase across the board, all departments, all funds, for health insurance increase. But when the mayor and I and Jennifer were working on trying to balance the budget at the baseline and trying to get it ready for presenting to you, when we printed the book, we thought, okay, we can find a way to get us down to about a 7% increase, because the maximum increase would be 12. We could come up with a couple different options, which we will be presenting to you yet. To get there, all the options we've got in front of us would get us down to 7%. But instead of going to everybody's department and just taking away roughly that 5% increase, I decided just to throw a negative number in here. So that's the line item you see on page 170. It's about $40,000 in the general fund, and then it's $10,000 spread between all the other funds, be it capital projects, water or sewer, and stormwater utility. Are there any questions? That kind of concludes the general fund. These other little funds are in other areas that are not paid for by the tax levy. Pages 185, 186, the post-health, the sick leave reserve fund that you have here, you used to fund it with the $60,000 tax levy, which was added to the taxes, that was paying for all the departments for any of those that have a sick leave balance upon retirement. After talking a little bit with Nina, how Nina's doing it, I thought there is a different way that we could kind of mirror what they're doing, to spread this not just in the general fund or having on the tax levy, have it funded across departments. That way you could spread the across the equipment maintenance fund, the street facility fund, the stormwater, the sewer fund, across other funds, some of our CIP projects, so that we could take that $60,000 and you don't have to have a tax levy line in there for this. But what we're doing is we added an extra fringe benefit line in every department of a 1% bank sick leave, so that it is available there upon need. And with the revenue sources for 2000, and that's the page I handed out here tonight for pages 185 and 186. I forgot to put in the extra revenue line for the $70,400. When we did this computation, we forgot to drop it in here. So the actual funding source is $70,400 from all departments, and then the $25,000 that Jen and Candy are aware of for those employees that will be Medicare age eligible and not be able to use up their full sick leave balance. So there's roughly about $25,000 of monies that we put aside already that they won't be able to use because they'll now be able to go on to Medicare. eligible. And then the estimate right now, we're estimating about $80,000 for those that would be eligible. Typically, we've been $60,000, but when Candy and I kind of computed how many might be retiring in the next 3 or 4 years, that number is at much higher than a $60,000 level. So we want to make sure we have it fully funded. So we're estimating maybe about $80,000, but yet our fund balance at the end of this calendar year, going into next year, is about $62,000. But we will need that because the amount we're paying out, if we keep with the 1% across the board, funding it for the next 3 or 4 years. And we could be lowered in time. Once we know we've kind of passed that period of time when we've got that wave of employees that will have left, we would be able to maybe lower that percentage. But right now, we kind of want to leave that fund balance there going forwards.
So a little bit of history. Before John was here and before I was here even, this fund was funded based upon anyone who was eligible within the next 5 years. We would fund that into that account. And during the steam plant, we actually rated that entire account. It went down to 0.
I thought it was eliminated.
It was. It was gone. There was no money in it. We used it for legal expenses. I think 3 years ago, that $60,000 was an arbitrary number. It was just a number that Peggy and I picked out of the air that we could fit in the budget, and we knew that it would help fund some of those payouts, and we wouldn't have to hold positions open as long, knowing that there were department heads that were coming up for retirement that we couldn't hold those positions open for nearly that long. And that's how that $60,000 came into play. This method is much more scientific. We've actually calculated things. We've determined what we need for funding and where it should come from based upon where those employees worked. So this is going back to where we were probably 15 years ago. And the $60,000 was just an arbitrary number that we could fit in the budget. So kudos to John for actually calculating something and making sure that we could fund these payouts.
Well, this was a team effort. I needed Candy and Jen's assistance on coming up with this because we needed to see how many projected retirees were coming up in the next 3 years, which Candy kind of has her pulse on that a little bit to some degree. They come and talk to her about these things and when the next Wisconsin retirement meeting is so that they can, find out about retirement benefits and things and get enrolled. And Jen has been the keeper of the accounting records for this fund since Tom left, I believe. So, or maybe even longer, so. If there are any other questions, we can move on to the next fund.
Can I ask why or how come this has become a benefit?
That predates both John and I. It has
I
been.
thought that after the steam plant, it was decided that that was going to be it, that wasn't something we were going to do anymore.
No.
Just the funding side of it.
So, not the policy. Okay, I thought it was the policy.
No, the policy was never changed. In fact, it's in some of the union contracts. So
So is this just for police?
this is for everyone.
It does not include fire, obviously.
Right, then it's only one union. We don't have any other unions.
Oh, we have a fire
Why is
department
it
union
that?
as well. Could you turn your mic on, Stan?
So then why is it that we continue to provide this benefit?
Because it was always in the personnel policy handbook for non-rep employees. So when the unions were dissolved, they became non-rep employees and they
Yeah.
followed the non-rep personnel policy handbook. Which,
I guess I'll have further discussion with John later on this, but I just have issues with it. We already pay a decent salary, I understand. It just seems like there's all these little extras all the time. And the rest of the world doesn't get this, and I don't care if the department heads don't like it or not. We have to look out for our taxpayers in this community. We pay so well, we provide the best benefits. And I keep hearing that, well, they'll go elsewhere. I don't think so.
Actually, we don't provide the best benefits as we've been looking
You
at
know what?
health insurance.
I'm telling you, the rest of the world does not live like this.
Compared to other municipalities, our benefits are not.
If you're in
as
government, you've got it made.
good. So, And the sick leave policy, from my understanding, this predates, may even predate you being on the council, Stan, I don't know. But that policy was put in place to eliminate short-term disability.
But
That's
back-
what that
But back then,
did.
this was something that was negotiated with all the different unions. And no one recertified themselves to be a part of a union anymore, because they all went along with Act 10, except for, of course, we all know that the police and fire under Act 10 basically allowed them to continue to have their unions.
Okay, let's back up, though. The reason that we give a sick leave bank is because we didn't want to fund short-term disability. Menasha Utilities has a short-term disability plan. They do not have this sick leave plan, but they pay more per year in short-term disability insurance benefits than we were paying for these sick leave benefits. And that's why some municipalities made the choice to do a sick leave plan, some a short-term disability plan.
One thing I could add, because I know Candy and I kind of had this discussion a little bit, is that you have to be an employee here like about 9 or 10 years before you even have any excess sick time that actually gets put into the bank.
Right.
Now, with the millennial generation, those that are younger than some of us here at the table, most likely a lot of them do not go, most of them may not be at a job 9 or 10 years at one employer to even be able to get to that benefit. Now, we have had a turnover of employees in the last, probably since Candy has been here.
I've been busy.
And there, a lot of, we've had some even like with the police department, they've started and they've left. There are probably others in our organization that have been hired in the last 3 years. They may not be here 9 or 10 years. So therefore, they're never even going to get to that. So the thing is, this might end up being a benefit that the amount keeps getting lower and lower and lower because you no longer have those long tenured employees because they go from job to job, they move elsewhere. So it's just, it might happen that if the funding level may end up going downward and downward and downward as you end up getting your employees maybe that are age 40 and up, age 50 and up, that maybe been with the organization for 10, 15, 20 years. But that next generation, the group that are age 20 to 35, they likely may not be with the organization more than 10 years and even get to this point because they might jump from job to job to job and move around. I don't know, maybe Attorney Captain maybe has something that she could add
I've
to
never
that
seen
too,
that
so.
here at City Hall. I've seen the same faces for 30 years or more.
Wow. Okay.
I can tell
we
you
got
that when I started here, which was in 2009, that we had 1, maybe 2 employees that would leave, and that was due to retirement. That is blown out of the water. How many people turn over?
Excellent.
And you could,
Yeah, but that's something we don't want though. Not for, we don't want turnover here.
that's
The only way that you're
that's the way it
actually,
is nowadays.
the only way you're eligible for that benefit is if you retire with the city as well. So
Correct.
if you leave the city at 60 years old and don't retire,
Oh, you gotta retire.
then you don't get that. Well, I shouldn't say 60. If you leave at 52, and you're not old enough to
That's
retire
That's
yet,
the other thing. We have people that can retire at age 50, was it?
52.
52.
that is based on WRS. We have no control over that.
I know, but I'm just saying.
So, but as John was saying, most of the millennials probably will not start here at 21 and retire here at 55 or 60 or whatever that age is. So,
Okay,
But we
I
can-
just
we can definitely
assumed
talk about that a
that this
little bit
was eliminated, so I guess I was wrong on that. And I guess I'll want to look more closely at what the policy is as far as entitlement to this, and maybe my opinion will completely
Yeah, and
change.
we can look at future. We cannot change the benefits that people have already earned, but we can look at new hires and changing those benefits.
Right, and I'm sure that those who qualify now are very much entitled or should have it. I agree.
Well, and it depends on
But I need to see the whole policy and how things change, because I was under the assumption that because of the steam plant, this got eliminated.
No, just the bank got eliminated, not the policy. And hopefully we'll have a full updated personnel policy handbook.
I was just gonna add that we are working on it right now for January of 2019, so.
Okay, moving right along. Next one is the self.
Question, please.
Oh, I'm
Sure.
sorry, Randy.
Thank you, Mayor. John, what is the maximum number of days? I know when I was teaching, you could accumulate up to 120, and then after 120, you still got your 10 days every year, but you couldn't accumulate anymore. So once you hit 120, you were calling in sick 10 days a year just because you had to use them, or that you lost them. So you could accumulate up to 120. What's the maximum number the city workers can accumulate?
Candy, I'll let you jump in on that one.
So currently, we get 15 days per year.
Okay, that's a bunch. Okay,
And
yes.
then in the regular sick leave, when we hit, it depends if you're a 7.5 hour or an 8 hour day.
Okay,
So for 7.5 hour day employees, it's it's 712.50
oh, you're talking hours or days?
hours.
Hours, okay.
So, employees can get, when their bank hits 900 hours, anything over that, 2/3 of it gets rolled into the banked.
Okay,
At retirement, the 712.50 or 720 for the 8 hour,
yeah.
that money goes to Precision. That's the money that Mr. Mayor was talking about. As far as when you leave, if you leave here as a retiree, you earn that, you get that.
Okay.
But if someone leaves, like today, I had a resignation notice come through,
Sure,
they're losing 900 and some hours.
okay.
That stays here.
So that's roughly, somebody just figured like 90 days for some of these workers, could be, for 720 hours.
Yep, 90 and 95, yep.
Yep, 90, 95 days, and if they're making, plus the 15, but if they're making, I'm trying to figure out the math here quick, but if they're doing 90 days and they're making $150 a day, so they're throwing away, they're losing about $1,500 then, possibly, or more.
Or more.
Or more, got it. Okay, thank you very much.
So the converted part, though, goes to a different fund, as you were saying.
So the funds that are over the 900 hours, we take 2/3 of that and we roll that into a bank sick, and that's the bank sick that we're talking about. So at retirement, they can stay on the health insurance and that premium comes out of that banked
And they can only stay on the health insurance until they're 65.
until they're 65 and then
That's why
they're
you saw that, was it 25,000?
25,000.
Returned, because some of the people that retired turned 65, and actually we have one that's still working, that's over 65, that will never get any of those funds, even though they have a bunch of money in that bank. But if they don't use that all towards health insurance, then it comes back to the city again.
13,000. Well, that's a big number, 13,000 that they get.
Does that answer your question, Randy?
Yes, it does. Thank you,
Okay.
Mayor. We figured it out. It's like 13,000. Good,
Yeah,
thank
I
you.
knew it wasn't 1,500.
No, no,
15,000 would make
15,000,
more
yes.
sense.
Then I'm really off here.
15,000 would make more sense.
Yes.
And a lot of people, if they were sick, they don't have money
Oh.
in that bank. There's not a lot of people that have banks. It was mainly department heads for the most part
Department heads.
that were here for 20 or 30 years.
That never
So,
left.
yes.
They work 12, 15, 17 hours a day.
Any other questions? Otherwise, we'll quick move on. Just a couple slides left. Self-funded dental insurance program. This has got a fund balance at the end of 2018 of 93,000 plus. We're looking with, there's a calculation that we get from our Cottingham Butler, our insurance broker, to fund it, make sure we're funding it enough each year. And right now, we're budgeting for about 132 being funded by all the departments, all the different funds, and we're estimating based on past experience about 122,500 in claims. So we're still operating with a decent, healthy fund balance there. Just in case you have 1 or 2 bad years, we can still afford that. Now, Patrick's favorite fund. The IT fund. We've got a lot of calculations and information in here so you can see the this is not just for your benefit, but this is also to show the allocation to all the departments so they can kind of see based on their requests for what software they're using, what equipment replacements they have coming in or out, depending on what year. Also, printing costs are in here. So it's a accumulation of a method that has been done here for a number of years here of that we're estimating. Now, as you remember, when we created the additional one full-time position to make it 2 full-time in this fund now, that we are using part of the fund balance that's in there to offset that so it's not putting the extra burden on the departments, at least when I share this information with you to 2021. We're still going to hold with that so that the funding level is $385,890 charged out to all the departments, but we're using fund balance of about $15,000, so the expenditure level is about $400,890. There is still a balance in there of $135,000. A good amount of that is carried forward from unused funds, not just from wages and fringe benefits or from contracted services unused last couple years that we've just let carry forward to help fund this, but also we've been putting some of the dollars away for the data management system for GIS and for parcel management, and that the Community Development Department and Public Works will be working with the IT department on trying to roll that out for next year. So that at least, I think it was roughly about $30,000 was the amount of that we had in the CIP fund, and that's totally funded directly out of the IT fund here of monies that had been put aside each year that we're now going to use that and apply that going forward to try to get this kicked off for next year. And Patrick, go ahead.
Also, part of the carryover funds that are in that dollar amount are part of the document imaging project, and that had been postponed primarily because of the changeover in the health department, because it was going to start in that department, and with the retirement of Sunette and the hiring of Nancy, she needed to get, all her other stuff in line before she had tackled that project. So that kind of got put on hold, but we retained the funds so we don't have to come up with those again. So that's part of that. I'm not sure when we're going to start that project, whether it is for sure in 2019. That will depend on whether another department or Nancy is ready to take on that project, of course, with IT's assistance. The unified database is well on its way to becoming a reality. So that'll be some very nice things coming down the pipe in 2019 regarding that. So
when we do the budget for it, there's this massive spreadsheet here. It's probably easier to look at the paper copy in front of you. But there is method that was created a number of years ago that there's allocation across all the different departments. And for 2019, some have an increase, some have a reduction based on what their needs are. Patrick met with all the departments just to find out what their needs were for 2019. And some departments have decreases, therefore they've decided on deferring some PC replacements and upgrades and things, whereas others maybe have increased a little bit more than others because they do have replacements that they have requested that they wanted to do in there. So, and that their department would then be charged for those. Otherwise, the only last slide I had left over was our favorite discussion right above us was on page 267. We have the CIP budget, which is for IT and Common Council. We had previously talked about this. We had put a number at that time, before we got additional quotes and information on it, was to upgrade the camera system, the receiver, and equipment for the council chambers, and the request for a fourth camera in here, which would make it easier for Dan to do the videotaping for us for these meetings. And now Patrick has gotten a better estimate on some of this based on the quote, and I'll let him talk to you about that.
Okay. You can imagine my dismay when he came in with the official quote at $9,000 more, and I called him out on it and said, you don't realize what you've done to me giving me this number and then coming in on paper with all the details at this much higher. His explanation was it had to do with some of the equipment needing to be a certain brand in order to make it work, as well as he forgot about the labor and licensing. So that being said, that's why this came in higher. There was a second quote which was about 6,000 and change higher than this. This is a full replacement of what we have. That way, we've got the enhanced video instead of the blurry, not as clear video, and it would also be a widescreen format. If you watch this on YouTube or you watch it on television, you have bars on the side of the screen. That's obviously, just a limitation of what our system is capable of. That it doesn't mean we can't continue that way. However, adding a fourth camera to the system, we would need to go to the secondary market to get it, since they don't make these cameras anymore. Therefore, it wouldn't be guaranteed by the vendor. The rest of the system, our controller is currently functioning. However, our recorder is having issues. We've had issues where we couldn't get it to record, and there were times where it recorded, but it didn't record audio. I'm at the mercy of the piece of equipment, and I don't want to guarantee its continued operation, going forward. We can definitely work with it the best we can, but if it does have that and continues to have that, we may have to do an emergency replacement if I can't get it up and running again. So this is in the CIP budget, and to what level we go with either partial replacement or full replacement is really up to the council.
Thank you, Mayor. I know Alderman Severnick has brought it up before a few times, and I have, and being out and about as much as we are and hearing the number of people that watch our council meetings, I just think, and I know Alderman Severnick brought up that we were actually the inventors, or we started the TV, and now every community has followed us. I think it's really important, Patrick, that we get, I would be in favor of the extra 9,000 to be able to have our council meetings being picture perfect, so.
Okay.
Including your brother.
I have a...
Anyways.
If I can comment.
The licensing thing is my issue. What kind of licensing? I don't understand why there would be any kind of licensing.
No, well, okay, well, let me
Usually it's
backtrack and then I'll...
programs or something like that. So I'm thinking of what kind of program that we have to pay any kind of licensing.
I guess I probably misspoke with the
Okay.
word. I
No,
apologize.
all right.
Licensing is probably not the proper word for that. I do have a correction. This quote of the 29,000 included $1,908 for a microphone, which I was told to remove, but the dollar amount that got put on the slide is still with that. And if you want microphones, they are $1,908. It's unbelievable. One like this, yeah. So it would drop down to the 29 or 27 essentially. Be 26,998. So, and that's, like I said, with the all new equipment, and everything would be guaranteed to work together. If we have to start looking at something other than a full replacement, we'll have limitations, and I will work with whatever is decided and get the appropriate quotes at that time. You know, if we can find a recorder that works with our current cameras, I don't know, because we didn't go that far on the first quote. It was like we asked them for an enhancement, and they basically came back and said, we can't do an enhancement with any type of guarantee of it fully working.
I just wanted to mention a little of the history behind this, because it's kind of funny. And James and I were involved in this, and before this, we wanted to at least have the public hear something or know something that was going on. So he and I each threw in $15 and we bought a tape recorder. And during one of the meetings, James set it out and they stopped the meeting. They wouldn't let us record the meeting. The funny thing about that, James doesn't want me to tell anybody, but he forgot to put the batteries in. And there were never any batteries in it.
I did forget. I put it up there like that, knowing
Yeah.
there was no batteries.
So,
Just the thread of a tape recorder up there
yeah,
shut down.
and now we can televise. Just to tell you, just to give you an idea of how the fighting that we had to do just to be able to get the meetings televised. You know, believing in open government.
Tell them about Mike King sitting there.
The what?
Mike King with his recorder.
Oh, yeah, Mike King had his recorder going, that was okay.
That was okay.
Yeah. All right.
He could record.
Alderman Nichols?
Thank you, Mayor. What is the age of the current system?
I believe we determined it started, was it 9 years ago or back in?
I was gonna say it has to be close to 15 years old.
Was it
still an
2002?
alderman when this happened.
2006 is when 2006, 2007 is when we.
I've been here very long. I'm one of those people who might be eligible for the payout when I retire.
Oh, yeah.
It might have been 2008.
And
10 to
Stan, that's
15
actually
years,
been one of the
somewhere in there.
reasons I'm still here is things like that. You know, because there've been times.
So the current system is anywhere from 10 to 15 years old.
Right, it
Thank
was put in, and did we make a replacement or enhancement partway through? We started recording the videos a few years prior to us buying the equipment, and they used to have to bring in the equipment from the UW, and they brought in those like cameras that you see in a studio. And I don't know if Dan was part of that at all or not, but yeah, and so the cost of labor of all of that precluded us to purchase the cameras. We've done well with what we have. It's just an aged system. And it is older technology, especially from the clarity. And if we're having all this money invested into closed captioning and stuff like that, but we still have cameras that are, more than a decade old, so.
Yeah, but you look better blurred.
Speak for yourself, Stan. Okay. Anything else on IT? No?
Something else.
What else you got?
Well, can I go back to like page 28?
No, that was Nancy's
Nancy?
presentation.
No, it wasn't, no, it wasn't. I'm just looking at the, it's the salary pieces of both the finance, comptroller and the human resources. If I'm looking at this correctly, it's like a 4% increase that we're gonna be giving for salaries next year. For example, page 28, if you look at salaries projected for the year of $173,000, and we're gonna put in 181 for 2019. It's like 4.2% increase.
We have one of our employees, one of our clerks at the front counter, she's in the STEP system because she was just hired new in July of 2017. So she has a STEP increase that comes effect every year. So she has a STEP increase there.
Okay, if that's what it is, if it's the
it's-
levels things in these
I mean,
departments.
it's similar to like the Public Works Department, that you've got employees that are on the STEP system and that they have not hit the maximum of that range yet. So I know we've got one person there. And depending on the salary scale, you've got steps that occur once you get past midpoint every other year right now, until you get to the 15th year, then there's like a 1% increase from year 15 to year 20 and from year 20 to 25 on the salary matrix, so.
Okay, that answers some of it then,
Okay.
thanks.
Anything else? Oh, Dan?
I just had one quick question. On the request from the different departments on the IT, the Public Works and the Parks Department had a significant increase. What was the reason for that large of an increase in those two departments?
I'm sorry, can you say the two departments again?
The Public Works and the Parks Department, their increase from last year to this year, one of them was like 7,000, the other one was 3,000 or something like that. They were the most significant increases for IT requests.
Okay. They have a larger increase in the Public Works area because they added some new equipment and new maintenance expenses. Let me just take a look at it here quick. They now have an additional software that does the diagnostics, and that added a little over $700. And their tools and equipment budget is higher. That's in their portion of the budget, but it shows up on the bottom line here.
Right.
But they actually chose to not take all that should be replaced. The city garage should have 4 replaced by our best practices scheduling, and we discussed it, and he's foregoing a new computer for himself and for one of his supervisors. And, so we're only buying 2 and likely going to go to the mechanics and to the administrative position in the department. Now, we may increase the sign shop as well, but that's within budgeted money for this year. They just haven't done it yet. So that would be a large portion of the cost due to the type of machines that are needed in that to run the software, especially with the GIS capabilities. They're more than a standard PC.
Right, and the Parks Department is joined in with that then? That's their portion of it? Okay.
Yeah, and they now have a total of 3, which they've had, but we are replacing with new some of the systems that are out there. We do some trickle down, but we had to replace parts of that system with new pieces in order to make it work with the new software for diagnostics that they have.
Okay, thank you.
And the other one was the Park and Rec Department. I'm trying to, what's it? Oh, I'm sorry. The biggest increase actually for police is the fiber expense. And that would also be the same for the Public Works Department. They had an increase in their fiber expense. We used to break that out like as a equal share to every department.
All departments.
But when we now have the ability to break it out by what building is actually getting that service, so it's kind of like the redistribution of the tax assessment. There are going to be some that might pay a little more and some that might pay a little less, but it's more fair once the valuation is set up. If they're getting the service that we have to pay that rental of the fiber fee, it should be their department that's in that building that gets it. This has been a change since I've been more involved in the actual budgeting process and thought that was a more appropriate way. So that's why those two departments, for those reasons, went up. The largest is a huge increase for the pool because the pool fiber rental, in order to get that online so it can be live, is $5,000 a year. After so many years, that will drop down after the initial build-out is paid off, but we're still a few years away, well, quite a few years away from that. Fiber, unfortunately, is not a very inexpensive tool, so.
We were gonna try to get this all on on one tape, but we're gonna have to break now, and then we'll come back and do clerk and attorney, because we only have 2 or 3 minutes left on this tape, so.
Computer, so I remember him